I request everyone who is sitting in the back side, please come and sit forward. You all, kindly come and sit forward. Everyone, I am Dr. Rajalakshmi, final year PG, Department of ENT, Shimoga Institute of Medical Science. It is an honor to welcome you all to today's workshop on dissertation to publication, a roadmap. Completing a dissertation is a major milestone, but transforming that research into a published work is where your academic voice truly begins to take shape. This session will walk you through the essential steps of how to choose a right dissertation topic, write a good quality dissertation, how to transform a dissertation into a journal article, respond to reviewers' feedback, and navigate ethical and formatting requirements. We will also touch on common pitfalls and how to avoid them, so your path from dissertation to publication is as smooth and successful as possible. This will be followed by a panel discussion. Whether you are just starting to think about publishing a paper or already revising your work, this workshop will be designed to support you in every step of your way. We will start the session with IMA prayer. I request everyone to stand up for the prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you. So let's get started. To formally commence today's workshop and to provide us with the introduction and preamble, it is my honor to invite Dr. Srikanth N. Hegde sir, esteemed consultant physician. We look forward to his words as he outlines the objectives and significance of this initiative of this session. Welcome, sir.
Thank you. A warm good morning, everyone. At the outset, I thank IMA President Dr. Sridhar and IMA Secretary Dr. Vinaya Srinivas for entrusting me with this job of conducting a workshop for PGs. As you all know that IMA Shimoga is in 75th year of its functioning, and as part of the Diamond Jubilee celebration, IMA Shimoga has taken up various projects for various sections of the society. for students, for general public, for doctors and their families, and also medical students. So Dr. Sridhar and Dr. Vinaya requested, can you take up 2 projects for medical students and postgraduates? One of the project we completed 2 months ago, that was a quiz program for undergraduates, and this is a second program. The idea for taking up this project, like a workshop for postgraduates, is one, to involve all the postgraduates from all the disciplines of 2 medical colleges and DNB training institutes in Shimoga. As you all know, India has a largest number of medical colleges and teaching institutions in the world. We have around 750 medical colleges, more than 700, nearly 800 medical colleges, plus around 60 institutes, standalone PG institutes. Together, we produce around 75,000 postgraduates every year and around 5,000 super specialists every year. This being the case, India should have been the front runner in academic standing also. But if you look at the research output from India over the last few years, it is nothing to cheer about. Like, for example, 10 years ago, India used to constitute a merely 3% of the global research output. And that has increased up to 7% in 2022. Even then, it's such a small number. But however, India, as of now, stands around in the 7th place in global research output. And the government of India intends to bring it to either 2nd place or even surpass China and to become the 1st place. So with this in mind, there are several initiatives by the government as well as from the institutions across the country. If we look at the number of publications from India, there, as I said earlier, that it's hardly anything to cheer about. It is just the numbers. If we look at the quality of the publication, it's nothing, it's further dismal. Because if you look at the top 10 medical journal of India, if in the world, the contribution from India constitutes less than 15%. Fortunately, we are in the 7th place even in that standing, and we hope to increase it further. There are several reasons which we don't want to discuss it here. So instead of being part of problem, we thought we'll be a part of solution by providing teaching and providing an environment for conducive research among the budding researchers and budding students, postgraduate students of this place. There was an article published somewhere in 2015 or so by Professor Samiran Nandi from All India Institute of Medical Sciences, which showed that at that time there were about 600 medical colleges in India. Nearly 60% of the medical colleges had not produced a single research paper in the previous 10 years. And only 5 institutions of India constituted about 40% of the total research produced from India. So you can imagine what those 5 institutions were at that time. And even then, things have improved a lot since that publication. That was probably the turning point in the academic publishing history of India. So colleges started taking up more interest in publication. The government started spending more on research and in promoting the culture of research and publication. So as we stand here today, the reason for choosing this topic is that the first encounter to research or publication among medical students is as undergraduate research students or in your post-graduation. Everyone as part of your MD or MS are supposed to do a thesis, and thesis is for most of them, it is their first research project. If we consider the number of, as I said earlier, there are around 75,000 medical PGs produced every year. There should be obviously 75,000 dissertation, and there should be 75,000 publications per year. Unfortunately, that's not happening because the quality of many times when the thesis is converted into a paper and sent for journal, most of the time it gets rejected. So the output from research output from dissertation has been low. So we have to start somewhere. That the best place to start is when you choose a topic of dissertation, then writing the dissertation, transforming it, submitting the journal. So to navigate this process, we have chosen this topic and we have taken the topics as such. The faculty for today are chosen from from the local speakers. 3 are senior professors from 2 medical colleges. 1 person is a scientist involved in multidisciplinary research, and 2 of us are in private practice, but we are in journal publication. So it's a mix of all sorts of people. Hopefully we should be able to convey you the gist of publication and how to conduct good research and how to conduct a good dissertation and transform it into a research article. I wish over the course of next 3 hours, all of you make best use of this and give a constructive feedback so that we can take up such interactive programs between PGs or undergraduate students from IMA Shimoga in the future years. Thank you. With this, we straight away start with the first presentation. I request Dr. Manjula to present her topic.
Full and insightful introduction and preamble. We truly appreciate your guidance and continued support for this academic initiative. I now have the pleasure of inviting Dr. Manjula Ma'am, Multidisciplinary Research Unit, Shimoga Institute of Medical Science, to address us on the topic of choosing the right dissertation topic, relevance, feasibility, and novelty. Let us welcome Ma'am to the stage.
Good morning, everyone. So let me introduce myself. I am Dr. Manjula, Scientist C, working in a multidisciplinary research unit, which is sponsored by the Department of Health Research, Shimoga Institute of Medical Science, Shimoga. From the past 10 years, I am working as a scientist in this unit. So my academic journey, I done my MPhil and PhD in biochemistry from the University of Mysore. And I started my career as a lecturer for the UG and PGs. And also, now I'm leading molecular and clinical research at MRU SIMS. And we also set up a molecular biology lab. And main work of my work actually is drive the projects, funding, lab management, and everything which is related to the research. So I am going to be, it is very pleasure to say that in MRU, so I am a co-investigator for 50 plus projects, and I have scientific publication of 30 plus, and expertise and skill, molecular biology, protein biochemistry, clinical research, as well as biostatistics. So let's start our today's topic, that is choosing the right dissertation topic in medical research. Mainly, I am concerning about relevance, feasibility, and novelty. So before starting this, now I want to interactive exercise. So take a moment to write down your topic. So or think about what actually you have chosen, the topic, which topic actually. So we can have, means in final of that presentation, you come to know your topic has a relevance, it has a feasibility, or it has a novelty like that. So please think about that, and if possible, write on that. Who are first year PGs, who are going to start, or who are undergraduates, who are to do the STS project or any research work. Okay, so before starting any research, one thing is very important, not only for the doing MD or doing something and want to publish like that. So first, one thing actually you want to know, personal interest and passion towards the research is very important. Without the passion or interest, the research actually is not going to be fulfilled. So first, choosing the right dissertation topic. First is relevance, which is going to address current healthcare needs or priorities. Next one is feasibility. So when I am going to choose the one topic or this one, then can I complete the what is research topic or study? Available sources are there that you want to think, that is the feasibility. Novelty, what is the expected outcome? It's add to the means how it is going to be useful for the society or contribute new knowledge to the field. So what makes topic relevant? So one is first for the relevant current healthcare issues actually, which is pressing medical challenges facing society today, like hypertension, it's a cardiovascular disease, diabetes, then migraine, everything, so many things is there. And which is going to be patient care benefits. So, which is going to be improve the treatment outcome or quality of the life of the subjects or the patients. And regional alignment. So, where means if that disease is not there, then you can't do that. So, in that region, what is actually is there and how many people they are suffering, what is the prevalence or incidence of this disease, can it is going to be possible, that actually you want to know, that is a geographical area. So how actually you are going to ensure relevance? So first one, review of current literature. So you want to thoroughly read the recent journals or publications, clinical trials, healthcare policies to identify the gap. So you want to find out what is the gap in the publication or previous studies. Then you are going to get an idea what actually I can do, new thing, okay? So, and also you want to consider the need more research, where actually that, in that research gap, where I am going to design a study. So next actually consult clinical experts. Your seniors, your guides, they know, they are the experts. Take to clinicians, healthcare professional or mentors about pressing issue in their practicing. So you want to ask, you want to discuss with the clinicians and professional. So what are the problems while treating in a hospital they are facing? What could be improvement you can do like that? Their insight actually it will helpful to understand what problems need attention in that field. Then you are going to do differently. So public health trends. So pay attention to the global health issues such as spread of infectious disease, the rise of chronic conditions, or challenges related to the healthcare accessibility and delivery. So next example of some relevant topics, let us consider cardiology. Impact of early detection of hypertension in young adults. So if you're going, this is the one of the cause, comorbidity, where hypertension is there, then it leads to so many comorbidities. So for that reason, if you're going to early detect that hypertension using some markers, so we are going to do some studies, that is plasminogen activating inhibitor. It may be going to become a good early detection marker for the hypertension. That we are doing such things. And endocrinology, role of dietary intervention in managing type 2 diabetes, oncology, efficiency of immunotherapy in lung cancer. Now, percentage of lung cancer is increased and it need early detection because it is going to be detected on third or secondary stage. And pediatric, impact of vaccination on childhood mortality. So now next come to the next topic, that is feasibility. So when you are going to choose a topic of your research, then you want to look actually, it is going to be the resource assessment is there. So when you're going to choose the topic, then you want to think what is resource availability is there, that is assessment. So patients are the number of patients is available and necessary resources going to be available, then only you can do, otherwise it is going to be hurdle again. So timeline planning. So in MD, only you can actually concentrate because 12 to 18 months, in that you want to finish everything, your exams is there, then you want to be, you want to time frame, actually you want to make a time frame. So this study is going to be possible. You can't take community level studies which will go to 5 years, 6 years like that. You want to take what population is there, amount of what is cases is more in your hospital or in your study settings. And obstacle and identification, that is, you want to clear any ethical or logistic or hurdles. So how to ensure this feasibility? So one is assess of data or participant. Ensure that you can easily assess a patient population, clinical data, or medical records for your research. So for that, actually, you want to take your institutional support and even ethical approval. Skill and expertise. Consider whether you have a necessary skill or can easily acquire them within the time frame. For example, if your topic requires advanced statistical analysis or lab technicians, then ensure you are either skilled or have a support to perform them. So one thing actually I noticed, only you're going to take clinical data and what actually in our OPD patients or inpatient data that you are going to do. So you are not going to do any biomarkers actually. It will cost nearly 30,000. You are not going to include, you are not going to the genomics, you are going to take the what is demographic data or clinical data, and you can, one gene assessment you can do, that you can do actually if you have a good lab actually. So then support from advisor or institution, discuss your potential topics with your dissertation guide, and ensure that the necessary infrastructure such as lab equipment, clinical setting is available to support you, because they are expert, they know in and through of the hospital or study centers. So feasibility examples, so I'm taken two. So pharmacology, adverse drug reaction in ICU patient. So why it is feasible means data already available in the hospital records. And pathology, study of biopsy samples in breast cancer. So samples routinely available in the pathology department. So easily the sample is going to be available and the time also is there. So you're not going to spend more time. So for that reason. So next actually the last topic, that is novelty. So it should be new angle, so unexplored territory and modern approach. Same prevalence, incidence, don't do all those things. New approach, and which is going to, outcome is going to be good and it is going to be helpful for the society. So how to ensure the novelty? One is main thing, new, that is literature reviews must actually. So now AA is there, you are going to give to this one chat GTP, and without knowing anything, you are going to write your dissertation topic. It's not good actually, you want to thoroughly read the literature survey actually, you want to make it, and read the journal. And look for under-researched area in that, or controversial in the field of interest, maybe two. Maybe they are going to say there this percentage of what is positiveness is there or negative. In some paper they are going to negative values, here positive, then that is a controversial actually report. Then you can take that data. If you find an area with conflicting evidence or limited studies, this could be what is fertile ground for new research. So, and you want to, next one is new technology or techniques. Use advancement in medical technology. I told you before, genomics or data science, to explore issues that were previously difficult to investigate. So look at underexplored patient population, study specific demographic group, okay, that are often underrepresented in clinical research. Pediatric population, ethnic minorities peoples, rural communities, there actually you can actually no such study is going to be available in tribal population or like that. So example, infectious disease, studying new antibiotic for resistant bacteria, evaluating telehealth for remote patient monitoring, neurology, investigating non-drug therapy for migraine relief. So few examples for good and bad dissertation topic. So you can see here. So prevalence of anemia in pregnant women attending rural PHC centers. So relevance is there, yes, common public health. Feasibility is also be there, easily accessible sample. You're going to get good number of samples because pregnant women, they will come to hospital. Novelty is not there because maybe too common unless stratified by the cause or trimester. So another one thing, gene expert versus acid-fast bacilli smear for TB diagnosis in HIV positive patient. Major issue in India, right? And novelty is also there, comparing diagnostic method add novelty. So, but feasibility, so may not be available in all hospitals. Then you want to send the sample to the outside. So data maybe you are not going to available. So for that reason you can't conduct. So some of the good topics actually, correlation between HbA1c and severity of CAD. In diabetic actually we are going to see HbA1c, but not in CAD. So CAD and diabetics are both prevalent, so you can actually add or estimate HbA1c. Feasibility, ECG labs are there and central labs is going to be there. Novelty, novel link between metabolic marker and heart disease. Next one, zinc supplement in diarrhea and its recurrent rate. So major cause of morbidity, simple intervention, still evolving protocol here. So correlation between grading and reporter status in breast carcinoma. So useful for prognosis, tissue blocks is going to be available in the pathology lab, and novelty, predictive relevance is there, you can do that. And another one, prevalence of anemia in CKD patient on dialysis. Its research is going on. High disease burden, patient available from dialysis unit, unexplored in certain age group, not in all. So you want to specify the age groups, then only it is going to be good novel work. So coming to what are the signs of bad and good dissertation topic. So if it is too broad, then it is a bad. Okay. So diabetics in what is elderly people or youngsters like that. Then overly ambitious for your time and resources, already heavily studied without a new angle, that type of studies don't take. Unclear outcomes or variables, because if you're going to take these dissertation topic, then you can't publish in a index journal. You want to wait for at least 6 months, 1 year like that. And you want to pay also for that. So without pay, and you want to publish in an index journal, then you want to choose first thing is good dissertation topic, and which requires unavailable technology or equipment, non-relevant to your clinical exposure, like that. So good, clear, defined population, variables, and outcomes. Relevant actually to your specialty, patient, and healthcare setting. Feasible in terms of time, ethics, and resources. Includes a novel element, new population, comparison, setting, and outcome, which is going to be helpful for the society, and a new thing, actually they are not done or less studied topic actually you want to choose. So now it comes to end topic. So now your thing, you have chosen some topic, right? It has a relevance, it has a feasibility, it has a novelty. Think about yourself. If it is not there, now make the correction. Who are under writing, actually we can't say, but who are starting their PG or who are undergraduate, or to start a new research for the publication, then please keep in mind. So one thing, anything you are done, it should be published. That also in index. If it is not indexed, then for the promotion, and nothing, actually it is not going to be counted for your growth. So for that reason, please keep in mind relevance, feasibility, and novelty. So question and discussion is open for you. Thank you.
Thought-provoking talk. We are truly honored by your presence and deeply appreciate the knowledge you have shared with us today. Now I kindly invite Dr. Vinaya Srinivas ma'am to give a token of appreciation. It is with great honor that I invite Dr. Balu sir, Professor, Department of PSM at Subaya Institute of Medical Science to share insights on the topic study designs and research methods, planning for a robust study. We are privileged to have Sir with us today, and we look forward for his valuable insights. Let us welcome Sir with a warm round of applause.
Uh, at the outset, let me thank Dr. Sridhar, Dr. Vinaya Madam, and Dr. Srikanth Tegde sir for giving me this opportunity to address PGs. And good coordination I'm seeing in the WhatsApp group and even before. I'm basically public health specialist. My main area of work is TB, and as a part of it, I'm chairman for the Government of India Task Force for 3 states, Telangana, Karnataka and Andhra Pradesh. I also work mainly now in the field of AI, for which we have set up Center for AI Research and E-Health at Subaya Institute of Medical Science. Through that, we support government agencies, do some small pilots. Now for this, I've kept it very simple. Because it's something like a snapshot, understanding study designs, more of examples, and it's up to you to figure out where does your study fit in, okay, because most of you are from clinical side, so you need to look at where your study particularly fits in. I'm audible, right? And then, okay. What you're able to see? Quickly, just to wake you up. What you're able to see? Nothing? Focus? Sorry? One carton box? Okay, great. Any radiology PG here can scan through it. Anything else? Focus. Hope you had breakfast. No hypoglycemia. No? Okay, at least you are able to, catch cartoon box. Let's see what is behind it. No, you are right. You missed this, right? Now, why do we miss? The previous slide was masked, right? It was blur. I purposely blurred it, put some images behind. Mind sees what you're trained for. Research is like that. You know, unless you're very clear on what you want to achieve, you will be missing many points. That's something like a mask, because our mind and body gets tuned to what I am thinking. There may be a risk factor, there may be a relevant thing coming up. Because we are not tuned to it, we don't pick it up. Okay, so that's the whole idea. How many of you like fruit salad? Raise your hands. Dr. Sridhar will arrange for lunch. Nobody? All of you like fruit salad? Great. How many of you have tasted a fruit salad which has jackfruit? One. All of you like jackfruit, right? All of us like fruit salad. Both are fruits. Now we put dragon fruit, all fruits in fruit salad. Why are people not putting jackfruit? And we eat everything from jackfruit. Adralli ಏನು ಬಿಡಲ್ಲ, right? If you go towards Kerala and Bangalore. Now this is a common thing. Wherever I go, I see this. Okay, this is your research question. That's how your research topic starts. Someone is not doing something, can I do it? Or something is missed in that topic, can I add it? Something like this crazy research, or let's take it as an example. Nobody is adding jackfruit to fruit salad. Let's add and see whether it makes any difference or does it taste better. So be careful with your research question. I'm not touching research question as such because my topic focuses more on study design. Before study design, it's your research question which is key. Unless you're not clear with your research question, your thesis will go haphazardly here and there, and finally you end up writing something. Sir was mentioning why we don't publish. That's the basic reason. There are two basic reasons. One, we are not clear with our research question. Second, we are not confident of our data. You know, many of us will come to that little later, how thesis also gets published. The next thing, whenever you go to guides or you meet someone, if you're somebody who is really interested, they always tell you, think out of the box. You know, think out of the box and take up some study. Madam also presented some ideas. My suggestion to all of you is first understand the box. If you're looking at doing some study, let's say on TB, understand everything about TB, then see, do we need to move to a new idea, or do we need to do a research which currently the program is not able to do it properly. Okay, so there's nothing like out of the box idea doesn't mean a new idea. It means an idea which can be brought into the existing system. So please be careful. Don't take up something new because somebody has not done it. It's good you take it. Like we have KFD problem in Shimoga, which is very unique. Somebody can take a thesis. Dengue is a unique problem to Shimoga. There are a lot of unique diseases in Shimoga which you can take. But make sure you understand completely about the disease before you move into taking up something new. How many of you participated in any research study? Any of you? 1, 2, 3, 4. ಯಾಕೆ ಅರ್ಧ ಕೈ ಎತ್ತಿದ್ರ ಅರ್ಧ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿದ್ರ ಮುಗಿಸ್ಲಿಲ್ವಾ? No, just I wanted to understand how many of you are actually taken up research or were part of some study during your UG or during your PG. So I put it in simple terms, okay, these study designs. I don't want to make it complicated, taking an example of type 2 diabetes, which is becoming a big problem in India, and most of our theses hover around NCDs, either diabetes, cardiovascular disease. If you are in pediatrics, it hovers around malnutrition, anemia, and few other things. So one research question. See, whenever your study design depends on what is your research question, what you are trying to achieve. And we put simply 2-3 objectives, which is also not required. And we put too many things in title, which is also not required. Your study design depends on your primary outcome. So usually we call it as, we just type 1, 2, 3 objective. It's not like that. There's something called primary objective, secondary objective. So your entire study design depends on what is the objective you're going to give, and everything depends on your first objective. That's the key outcome of your study. Rest of the things are, you know, binary product of whatever research you do. I've just taken this example, and let's see how the same topic can be done easily also, moderately tough, and tougher. The easiest way to do this is take some 100 interns, go all over Shimoga, collect 1,000 adults, collect self-reported data on physical activity, and test blood sugar level. This is something like camp we do. It's a snapshot. You just go collect data. Because at the end of the day, what you want to know is physical inactivity leading to type 2 diabetes. Now this is the data you get at the end of service. This is what we present in most of our conference as PGs. 25% or whatever percent of adult had diabetes when compared to 10% in active adults. Now these study designs don't prove causation. Causation means this: by doing a cross-sectional study, you can't directly link physical activity itself, inactivity itself cause diabetes. Okay, these are fine to get a prevalence of inactive people having diabetes, or you want to compare inactivity, diabetes, and glucose level. Those kind of things are fine, but most of your thesis, clinical thesis, look at causation. Okay, so just that is where you need to look at what study design you are going to use. These kind of study designs can't prove causation. This is what we call it as cross-sectional or descriptive studies, which is most commonly done in surveys. 70% of your PG thesis fit in this particular domain, clinical, preclinical, whatever it may be. So we are not going in detail. These are basically to find out hypothesis or a new research question. You go in Shimoga 100 places, do a survey for dengue, trying to find out, is there anything which I can come out with this survey which can identify, okay, this may be causing dengue, right? Now the same study, you can do it also in your hospital setting. How you can do, you take all newly diagnosed diabetic patients, 200, I'm just giving an example. Take similarly 200 non-diabetic patient, ask both of them retrospectively that how many weeks, there is definitions for physical activity. You can take and do this particular study in hospital setting. So here, this is what we call it as case control studies, where you have case, that is a person with disease, control a person without that disease. Please do make this, I want to make this point clear. Control does not mean normal. Because you are doing in a hospital setting, whenever you are doing a case control study, your control has to be from the same place. Otherwise it leads to bias. Most of you don't do this case control studies unless someone is looking for estimating risk factors or looking at some pregnancy outcomes by some interventions. Then you take up case control studies. Again, they are not ideal for proving causation. Okay, means we can't directly again say this led to X led to Z. But up to certain extent, yes. In rare diseases, case control studies will help us to look at identifying what led to this disease. They are more prone to bias because you're asking 2-3 years previous data. Some people remember, some people don't remember. This is what most of you do from clinical side, which we call it as clinical trials. Take large number of people, randomly divide them into 2 groups. One group you do intervention, then another group you don't do intervention, follow up for 5 years, right? And see how things turn out. This is very expensive. These cohort studies in India we don't do unless it is funded. But yes, you can take it up not as thesis, but as a part of your research, because you have for 3 years, if you want to take up one particular research topic and follow that patient over long period of time, it will give good inputs. But we don't recommend it. It's very, very time consuming, expensive. There's lot of loss to follow up. You have to have a lot of money to make sure you reach the patient and collect the data. So this was, I was talking about the RCT. Most of your thesis falls here, but you people put it as observational studies, or sometimes I've seen, any OBG PGs here? Fine, don't lift hand, it is fine. I've seen many times you compare low dose progesterone versus high dose progesterone, low dose misoprostol, some variations you do in your drugging, right? Even in clinical medicine also, you may be doing it. You put it as clinical, you put it as observational or a cross-sectional study, which in fact it's not a cross-sectional study. Whenever you're doing some intervention, automatically it becomes a clinical trial. Intervention does not necessarily mean physical activity. Even a variation in drug dosage, variation in your protocols, surgical protocols, it automatically ends up in clinical trial. So you need to be very careful when you are doing this comparative study between drugs, because unfortunately we are not registering it. They are supposed to be registered in CTRI, right? I think Dr. Vikram and others will talk. Any drug variations, any surgical procedure variations, they automatically come under clinical trial. So be careful, whatever you're trying to do. For thesis, it is fine. But in some institutes, thesis also gets registered in CTRI if you're using new drugs, new procedures. So these are some things. What I want to stress is most of your studies either fit in cross-sectional, whether you're clinical or in public health. Clinicals who are using drugs, although you mention it as cross-sectional, they automatically come under RCTs. Whether you are doing randomization or not, it is fine. But yes, they fit under RCT. Now let's look at this next question. You understood about study design. Next is about sample size. I've just taken one more example to assess the effect of the drug on reducing blood sugar level. Title is changed. Okay, how to decide on sample size? What do? You go to the statistician, correct? Or you ask some PSM PG or somebody whom you know to estimate the sample size. So they give you this number. How many of you sitting here have already started thesis which has more than 200 sample size? Clinical side PGs? Only 2. Yeah, this is what? No, I'm not saying you should have large sample size. Why I'm asked this question is, many a times if you want to get a good outcome, you need to have a good sample size. I'm not saying large, good. When you go, most of the times, even with some of the PGs comes to us or statistician, sir, ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆಯಿತು ಅಡ್ಜಸ್ಟ್ ಮಾಡಿ. ನೀವು ಕೇಳಿದ್ದೀರಾ? ಹಾಂ, ವಿ ಆಸ್ ಸರ್ ಅದು ಫೀಲ್ಡಿಗೆ ಹೋಗಿ ಮಾಡೋದು ಕಷ್ಟ ಆಗ್ತದೆ, 600 ಜನ ಬೇಡ, ಒಂದು ಸ್ವಲ್ಪ ಅಡ್ಜಸ್ಟ್ ಮಾಡಿ, ರೈಟ್? Statistician does it for him what? Look at the numbers here, right? I have kept, just to give an example, 95% confidence interval, your sample size is how much? 385. So you requested, I adjusted, I brought it to 80. What is your sample size? Huh? You're happy? Most of them will be happy. Because 40 is very easy, no? Right? Your sample size is key for your research. I'm not saying you can't do this. You can still do this. But your outcomes can't be comparable, 1. And 2, we can't take the data for any evidence. Okay? That is how these things work. I'll not go into these details. Whenever you're taking up your sample size, make sure your primary objective, that is the first objective, prevalence or whatever data you have got, that has to be used for estimating sample size. Okay? You get in journals and make sure it is the latest ones. Again, I'll not go into all this because of shortage of time. Your sample size also determines on what is your goal, what you're trying to achieve. Like in this, we want to reduce the blood sugar level. By how much? If your drug, whatever you're using, you know, it lowers the blood sugar by little, means there is very minimal variation. You need more people to validate your study. If the impact is good, it brings down by 30, you need lesser sample size. So sample size just does not depend on your prevalence or anything, it depends on your outcome. See, when you write your thesis, you write your title, objective. First write your outcome, what you're trying to achieve. Based on the outcome, come back and look at what is your sample size which is appropriate to reach that goal. Okay, so that is how it should be done. 95% is always good because you saw the sample is good numbers. You bring down to 80, still it is good. I'm not saying it is bad, but it is 41. It can't be generalized. So this is how things work. Anyway, they'll share the slide. Because of shortage, I'll not go into this. Clinical side, the second point is very important. You have multiple data coming in there. You have cholesterol, you have FBS, so many multiple parameters. So you need to have a good large sample size to get a good outcome. Something similar in PSM. Okay, so let's not go into this. So think about these things whenever you want to decide on sample size. Don't just go to statistician. Statistician will give you only what you ask for. You ask 400, he will give you 400. You ask 40, he will give you 40. But as a researcher, ask this question: what is your goal? Is the drug or whatever intervention you're trying to do, is it big? Means the changes are big. Is there too much variations or parameters in your data set? And how confident you want to be on your own data? 95, 80, 70. Whatever is up to you. But please keep it at 95. This is the last one, general tips. Whenever you are trying, most of you would be using, please use specific, mention specific definitions. And latest ones which are applicable to India. Sometimes we mention guidelines which are not relevant to Indian context. Before taking up your thesis or research, run it on small number of participants just to make sure whatever you have defined, inclusion criteria, exclusion criteria, or whatever you are trying to do, run it on few people to see is it going correctly or is it going wrong somewhere. So that before you start your bigger study, you can tweak it. This is the most common thing we do. We restrict or put a very rigid inclusion-exclusion criteria. Okay, just make sure, keep it as broader as possible so that your results gets generalized. Inclusion adruddu ulta exclusion bardu patient not willing, male patient willing anta bardirtira, mattyak patient not willing, right? So look at keeping your inclusion-exclusion criteria much broader. Don't make it rigid so that there is an inclusive number of participants who can be part of your research. Exclusion should be based only on safety. If you think there is a confounding factor which can impact the results, feasibility as mentioned. Okay, don't write simply less than 18 years. It's nothing to do. When your study doesn't focus on less than 18 years, why you want to mention it in exclusion criteria? The last most important thing most clinical PGs may miss is the instruments and tools you use. It may be your diagnostic tool, it may be your surgical procedure, whatever it may be implants. You should mention it very, very clearly in your methodology, which many people miss. Even in PSM people miss. We don't mention complete tool what we are using, so that tomorrow somebody wants to go back and refer. We need to know which equipment was used. Every equipment gives a different results. And there are a lot of softwares. People simply mention SPSS 23 was used. SPSS 23 cost 18 lakhs. If you want to have a full package, whatever you are using is a cracked or a pirated version. So make sure whenever you are writing your thesis, ask the statistician, all the earlier versions will be free, or if the college has a good paid version, then only mention it. Otherwise, you are liable to be sued by SPSS. Although they are not doing it now, we don't know when things go wrong. Okay. So this is it from me. Just kept it brief. I'll take the questions at the end, or however, we'll take it at the end, sir. Yeah. Thank you.
Thank you so much, sir. We are grateful for your contribution and clarity with which you presented such an important aspect of research planning. Thank you once again, sir. I now invite Dr. Sridhar, sir, IMA President, IMA Shimoga, to kindly come forward and present a token of gratitude to Dr. Balu, sir. It is with great pleasure that we now begin the formal inauguration of this workshop. I would like to invite IMA President Dr. Sridhar S. sir and IMA Secretary Dr. Vinaya ma'am onto the stage. I also would like to invite distinguished speakers of today's workshop to the stage to light the ceremonial lamp. Shrikant N. Hegde sir to the stage. Also, I would like to invite Dr. Manjula ma'am to the stage. I would like to invite Dr. Balu sir onto the stage. I would like to invite Dr. Anupama ma'am onto the stage. I would like to invite Dr. Arif sir to the stage. I would like to invite Dr. Vikram Kumar sir onto the stage. Now I invite Dr. Vinaya ma'am, IMA Secretary, for giving welcoming address.
Good morning, everyone. So this is a very brief formal inauguration of the workshop. Workshop has already started, as all of you know. I take this opportunity to welcome Dr. Shrikant N. Hegde sir, who is the key point or the main instrumental person in organizing this workshop. When we requested him, he wholeheartedly agreed and taken all efforts to organize this workshop program. I welcome you, sir. I also welcome Dr. Mohammad Arif, sir, who is also one of the resource persons for today's workshop. I welcome Dr. Anupama Vijay, ma'am, who is one of the speakers for this workshop. I welcome Dr. Manjula, ma'am, for this workshop. I welcome Dr. Balu, sir, and Dr. Vikram, sir, for this workshop. I also welcome Dr. Sridhar IAS, President IMA, for this workshop. I welcome all the beloved postgraduates who have come from both the institutions to take the benefit of the various sessions of the workshop. I welcome you all. Thank you, one and all.
I now have the privilege to invite Dr. Sridhar sir, IMA President, to deliver the presidential address. I would like to invite the distinguished speakers of today's workshop to light the ceremonial lamp.
One postgraduate.
I now have the privilege of inviting Dr. Sridhar sir, IMA President, to deliver the presidential address.
Respected dignitaries on the dais and my dear students. In fact, IMA Shimoga celebrating 75th anniversary, Amruta Mahotsava, whole this year. So we are planning a new programs for the community, for the students, and this is the dream project. Our secretary, Dr. IMA Shimoga. She was there since September. We asked to do some project work to the PG students. Now it comes to the true now. It's because of it's the man behind, the brain behind this project and this program is Dr. Shrikant Tegde. He's a very good, he's also a teacher for us, both of teachers for us in KMC Hubli, for me and Dr. Vinaya Srinivas. And he was there good in, as a student also, he's a very good teacher, as a postgraduate student, and now also he is a very good teacher also, and very good academician also. So, ಈ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಮಾಡ್ತಿರೋದು ನಮ್ಮ ಅಪ್ಕಮಿಂಗ್ ಫ್ಯೂಚರ್ ಡಾಕ್ಟರ್ಸ್ ಆಫ್ ಕರ್ನಾಟಕ ಆ್ಯಂಡ್ ಭಾರತ್. ಯು ಶುಡ್ ಹ್ಯಾವ್ ಎ ವೆರಿ ಗುಡ್ ಡ್ರೀಮ್ಸ್. ಯಾಕೆ ಅಂತಂದರೆ ಎಲ್ಲ ಮೆಡಿಕಲ್ ಕಾಲೇಜಲ್ಲಿ ಥೀಸಿಸ್ದು ಎಲ್ಲ ಎಥಿಕಲ್ ಕಮಿಟಿ ಇರುತ್ತೆ, ಎಲ್ಲದೂ ನಡೀತಾ ಇರುತ್ತೆ. ತುಂಬ NMCನೂ ಸೋ ಮೆನಿ ಆ್ಯಕ್ಟಿವಿಟೀಸ್ ಆರ್ ನಾವು ಕಮಿಂಗ್ ಓವರ್ ದೇರ್. ಸ್ಟಿಲ್ ವಿ ಥಾಟ್ ದಟ್ ವಿ ಹ್ಯಾವ್ ಟು ಎನ್ಕರೇಜ್ ದ ಸ್ಟೂಡೆಂಟ್ಸ್ ಇನ್ ಎ ಬೆಟರ್ ಕ್ವಾಲಿಟಿ, ಇನ್ ಎ ಕ್ಲಾಸ್ ರೂಮ್ ಟೈಪ್. So that this project will be a landmark, not only Shimoga, in every part of Karnataka and every part of India. It's a live stream is going to everywhere there. So with this, I hope students take the positive benefits and keep spread to your own colleagues to other places, so that let us join to the live stream also. And next 20th of this next Sunday, we have a HPV vaccination program for the especially medical students, females, both medical colleges. Let us utilize that program also. So IMA Shimoga keep on doing the good programs. In the month of May, we are doing a mass diabetes screening programs. So bhada jana PG students bandidira, please come forward and join to this work. So many activities now ಮಾಡ್ತಾ ಇರ್ತೀವಿ. Not only this, we have a CME programs ಇರುತ್ತೆ. ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮಕ್ಕೂ you have a message, come and join, enrich your knowledge. The only bonding is academics. Academics ಇದ್ರೇನೆ ನಿಮ್ಮ ಲೈಫು, academics ಇದ್ರೇನೆ ನಿಮ್ಮ ಬಾಂಡಿಂಗು, academics ಇದ್ರೇನೆ ನಿಮ್ಮ ಎನ್ವೈರನ್ಮೆಂಟ್ ಚೆನ್ನಾಗಿರುತ್ತೆ. Without academics, for a doctor, spending a time is, I think, not fruitful. Till your practice, academics is very important. ಸೊ ನಾಳೆ ನೀವು ಸಹ ಟೀಚರ್ ಆಗ್ತೀರಾ, ನಾಳೆ ನೀವು ಸಹ ಮೆಡಿಕಲ್ ಕಾಲೇಜಲ್ಲಿ ಹೋಲ್ಡಿಂಗ್ ಎ ಗುಡ್ ಪೋಸ್ಟ್. ಕೀಪಿಂಗ್ ಇನ್ ಮೈಂಡ್ academics is the main part of, as heart of our life. Keeping in that aspects, keep growing with the academics. That's very important. And research. So two things are very important. So utilize this program and hope all the dignities, they are all stalwarts of Shimoga in both medical colleges that take an interest, because when we choose the speaker, this is also a challenging task, because right person for a right topic is very important. For that purpose, we invited all the speakers. Thank you very much from the team IMA for those speakers come over here and giving the spread the knowledge to the all of you. Once again, all the speakers, in spite of Sunday, usually Sunday and Tashna, ಎಲ್ಲರೂ ಹೊರಮುಖ ನೋಡ್ತಾರೆ, ಆದರೂ ಅವರು ನಿಮಗೋಸ್ಕರ ಬಂದು ನಿಮಗೋಸ್ಕರ ನಾಲೆಡ್ಜ್ ಸ್ಪ್ರೆಡ್ ಮಾಡ್ತಿದ್ದಾರೆ. ನೀವು ಒಂದು ಸತಿ ಜೋರಾಗಿ ಚಪ್ಪಾಳೆ ಹೊಡೆದ್ರೆ ಅವ್ರಿಗೆ ಜೋರಾಗಿ ಹೊಡಿಬೇಕು, ಹಂಗೆಲ್ಲ ಇದಾಗಲ್ಲ. ಇನ್ನೂ ಜೋರ ಹೊಡೀರಿ ನೋಡೋಣ. ಓಕೆ, ಗುಡ್, ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
I now invite Dr. Kaustuba Arun ma'am to deliver the vote of thanks.
Namaste. We all practice medicine with the aim to better the society, and we all know research is crucial in medicine practice as it drives advancements in healthcare, leading to improved treatment, diagnostics, and personalized care. And what a way to celebrate 75th year of IMA Shimoga. Thank you, team IMA Shimoga, headed by Dr. Sridhar S., our president, Dr. Vinaya Srinivas, secretary IMA Shimoga, for this initiative. This selection of topics and speakers says it's all. The amount of work which has gone into it to make this workshop reality. Sincere thanks to Dr. Shrikant and Hegde, sir, for this. Well, the speakers, Dr. Manjula, Dr. Balu, Dr. Vikram, Dr. Shrikant Hegde, sir, Dr. Anupama, Dr. Arif. They are the experts in their field. It is our duty to thank them for their time and efforts. For workshops like this, the target population, that is the postgraduates and all who are interested in research are very important. Your presence in this number is the validation that it is a well thought of program. Thank you. We are duty bound to thank the media personnel who are present here for taking this program onto YouTube. Also, we thank the office staff of IMA Shimoga. Thank you one and all.
We will now take a short break for tea and snacks. We will reassemble shortly. Lunch will be there at the end of this session.
Snacks
Sir, Professor, Department of General Surgery, Shimoga Institute of Medical Science, to address us on the crucial topic, writing a good quality dissertation, clarity and common pitfalls. We eagerly look forward to Sir's guidance on producing high quality dissertation while avoiding common mistakes. Please join me in welcoming Sir to the stage with a warm round of applause.
Password. Manjula, password.
I forgot that.
Am I audible? Okay. Are you late? Fan illa, late. Okay. Should I tell good morning or good afternoon? Okay. This program is for you people. Okay, it's a workshop. It's not a lecture where I keep on talking and you keep on listening. Okay, make it more interactive. Everything is known. Only thing is we'll put it in a proper format. You go in a proper, how to write a correct dissertation should follow a particular format. Okay, thesis or dissertation. These are two very different words which we keep on using intermittently. Sometimes we tell thesis, sometimes we tell dissertation. Do you know what exactly is the difference? Is there any difference or there is no difference? I want interactive speech class because I will not take much of your time. Yeah. Both are same or different? Okay. So these both words are often used. In US and all, thesis is a master's program, dissertation is a PhD program or postdoctoral. In the UK and other countries, in India also, what we are doing is we tell dissertation for the master's program, thesis for a PhD program. Okay. The little difference is thesis will just going into deeper and deeper and deeper into one particular core subject or topic. Okay. So one of our professors in high school or PUC used to say, specialization is going so detailed. Specialization is a process where we start studying more and more about smaller and smaller and smaller things. Ultimately, we will know everything about nothing. Okay, that was a jokingly I told you. So we have gone into that area. So these are I don't have to talk about myself. I am here as a resource person because I've been in the medical education since last 23, 24 years. More than that, I have worked after my MS from Bangalore Medical College. I studied my MS. I worked in St. John's and then I was in some private college. After coming here, I'm last 16, 17 years. So I was fortunate to be a member secretary of the Institutional Ethics Committee. There we got an opportunity to analyze and talk about more of research papers and all, hundreds of papers. Okay, just for the, see, staff used to write papers just for the sake of promotion. PGs used to write papers just for the sake of getting a degree. All these things happen. So there are many shortcomings and pitfalls which we'll discuss later, how when they come with us. So I'll just tell you what should not be done, then what should be done. Okay, so I don't have to be telling more about myself. So our speakers on the dais already spoke about how to choose a proper dissertation topic. Okay, so they already choose novelty, feasibility, relevance, everything counts. Once you have chosen a topic, what are the things? This is a general outlay plan, what you are doing. So don't wait for the last minute to submit your synopsis or dissertation topic. So start early and plan accordingly, because writing a dissertation is not a simple task. It's going to take a lot of your time and also stress, and you have to, because we know that you are working in good hospitals where there is a lot of clinical work, other work, laboratory work. So finding time to find out what should I do, or see, there are two things. First, when we go to the introduction part, this is the structure what is followed. Okay, every dissertation will have these headings. What is introduction? In introduction, you are writing why, only you are answering two questions. What am I doing? Many PGs will not know what they are doing, why they are doing that dissertation, that also they will not know. And next question is why it is important to take up that topic. So these two questions has to be answered properly. For that, keeping that in mind, how to write an introduction? Introduction is not, though it comes in the first part of the dissertation, most of the time it is better you write it down, brief things first. When you finish the dissertation, you will get a very clear idea what should have been included in the introduction. So introduction will be written in the end. It will be written in the end but projected in the starting. You may get confused. Okay. To write an introduction, first you should have a background knowledge of what is the current health problem, whether you are going to collect data by yourself or you are going to depend on somebody, or whether the data collected has to be analyzed. So you have to go for the literature search. Don't take up some remote disease which is not there in your particular area. Remote disease or remote lab investigation. What happens? People will take up a research project doing hi-fi investigations as a predictor tool or prognostic tool or something like that. What happens is when they come to the data collection or analysis or sampling methods and all those things, what they do in the materials and methods, either there will be a shortage of funds or they will not be able to go to that particular area or the population and start collecting data. It's all, so many things are there. I will just tell you the basic things. What are the difficulties a PG student, in spite of his busy work or his or her busy work, will find all these things. Okay. So background information about the local health problem is a very important. Okay. Available facilities is a very important. Then, as already the previous speakers had told, what is this research question? See, research means what? Somebody has already searched it and you are searching it again. Okay. Research means that's the only thing. The scientific knowledge is again. So when you see, take a particular topic or a particular disease, you will find out, if you read about 10 articles, you will find out these people have done these things. So are there any gaps? Are there any gaps in the knowledge? Should I do something which will fill that gap? Okay. A dissertation actually is not just for passing the exams or presenting to the university and getting a degree. So it should put in some additional information which is useful to the society or the mankind in general. Okay. So with that in mind, you have to start your work. Okay. As Madam was telling, it's not just a academic exercise. It should come like a passion. Okay. And the topic what you choose should be of interest to you. It should not take topic something which your guide tells. Most of the time it happens. when we give the research, and I being the HOD of a big department, I will allot the guide and the student. What guide will have his interest, he will tell the topic, but he will not guide. Student will be in loss, what to do, what not to do. He is in between, crossroads. That should not happen. You choose your topic of interest, see whether there is existing literature on that proper, see that disease is prevalent or not, is it feasible for me to do that study, then go and approach, and these are the research gaps which I am going to fill. I'll find an answer to the question. I'll just put one question to you. So that these are two examples I have put. One is a poorly defined research question. See, the first question, if you take up this as a research, your findings will be somewhere. How do people feel about the environment? When we sat outside taking the photo session, we were all getting heat strokes. Okay, different people feel differently. This has nothing to do. Neither it has a scope, nor it has any particular idea, among who, which people, which environment, nothing is there. So it's a very vague research question. Just for example, I have put like that. The same question, which you can put it in a different way, like in the second, this one what I have depicted, what are the impact of a community-based cycling program on attitudes, some particular group of population, or this is how, see, there should be a scope, okay? So define it like that. Will not go into the much details of that because of lack of time. Next comes after the introduction, when you have a background, that's what you're writing. Introduction should not be one paragraph or two paragraphs. It can extend for 2 or 3 pages also. Okay, don't be fixed to introduction is only this much. So see, introduction is what? It's like a trailer of a film. If you show the trailer properly, the person who is reading your thesis or your paper or whatever it is, he will find interest. Okay, so create that interest. This was the lacunae, this was the data. I have filled in that data. I have filled in that lacune. So create the awareness in the minds of the reader. It's dissertation is what I call it as a brainchild. Okay, this is your production, my home production. I am going to make others follow me in future or develop on this matter, because nobody is perfect in this imperfected world. Okay, so many people have done, many people have made some, left out something. It's not that they have made mistakes. They have their limitations, they have left out some lacunae that I am covering. Okay, that is the background. Formulate a proper research question. So it requires a lot of exercise. Okay, be specific and all those things. Now comes the next heading, that is the objectives. Objectives means, what is the difference between aims and objectives? See, this is one slide only I have put. We keep on telling, first we write aims. What is the aim? Aim is a broad goal. Okay, it's one sentence, what you are going to do. What is your aim in life? If somebody asks you, I want to take up the MD/MS examination, I have to pass. What are the objectives you can frame for that? I have to do the BCBR exam, I have to do the GCP training, I have to do the ACLS training, I have to write a dissertation, I should complete my 3 years of study. So these are your different steps what you are going to follow, ultimately give the final year MD/MS or DNB exam and pass the exam. Correct? You understood? So objectives are small bits which are done in hierarchy. Hierarchy in the sense, the first one comes first, the second one comes second. So it's not be the complications first and the etiology last, something like that. Okay? This is, I don't want to read what is there. I am not in favor of PowerPoint presentations also, because Man Ki Baat carries more impression than. So aim is a broad statement, it's a broad goal. Objectives are the subsets, or the primary objectives and secondary objectives, what sir was telling, Balu sir was telling. So you can define it. So primary objective, secondary objective, whatever is the objective, all are directed towards achieving that final aim. Okay. For example, take one example. To evaluate the effectiveness of a new teaching method for improving the student performance in applied clinical medicine. If that is my aim, so what are the objectives I am going to do? First, I should know, before applying a new teaching method, I should know what are the existing teaching methods. how much they are fruitful, how much they are effective, okay? And what were the students' performance in the older methods? If I apply this new method, what is going to change? Are the students going to mentally accept? Is it okay? Is it going to improve their performance? Is it level of understanding going to be much altered? There should be some significant improvement after you apply the method. Then it becomes reasonable, okay? So these are the just, for example, I have put it this one. So don't keep too many objectives. If you keep too many objectives in your short span of time, see already the time you submit your synopsis, it will be 6 months. After that, in 1.5 year, you have to finish your dissertation. What is a good dissertation? A good dissertation is a finished dissertation. Okay, ultimately you have to finish your dissertation. Don't keep it open and without conclusions. It should not be like that. Okay, you have to finish it within the given time frame of your studies. That will, even if it's a pilot study for a bigger population, it's okay, no problem. This is just a introduction. Make your mind towards a research paper. Because in Western countries, sir was telling, too much emphasis is given on research. When you go to apply for a USMLE or a PhD program outside, they will ask you, for a UG student, they will ask you how many papers you have published, how many STS projects you have taken. Like that, they will ask you. In India, we don't give that much importance for that. That's the problem. Okay. So when you frame an objective, you have to be smart. This has been told repeatedly by all the research the classes they told. What is being smart? S stands for, you have to have a very clearly defined and unambiguous, that is specific. Then whatever data you are collecting, it should be in a measurable format. It should be realistic within the scope of the study, relevant or realistic, achievable. If you see, the example is, it might be realistic to plan to lose 10 pounds in 1 year. Unrealistic to, if you tell, I will lose 10 pounds. If somebody has 10 pounds in 1 week, it is very unrealistic. So that is just an example. And it should be within the time frame. Already I have told you, specific, measurable, achievable, relevant, and time bound. So these are the characteristics of a good objective. So smart objective, okay? This is already I have told you, identify, see people, those who are doing a dissertation, they have to write that research question and keep it on their, pasted on their table. So why? Because that will direct them, I am going to do in and around that question itself. I should not get deviated from my, this one, for my main objective, okay? So again, one more thing is, and when you are writing the objectives, you can use action verbs like to assess, to compare, to determine, to evaluate, all those things, okay? Don't make, don't use very high-fi sentences or high-tech sentences or very jargon speech or very complicated speech. Make it as simple and straightforward, okay? So that the reader also enjoys. People think if I use a very high-tech knowledge or high-tech alphabets, my dissertation will become very good. Sometimes people will think if I write 300 pages, my book is very good. It's not like that. Length never equals quality. Length is not equal to quality. Quality is very determined. Quality has to be determined, okay? This already I have told you. And avoid the words, what is there in the last sentence. You avoid to appreciate, to believe, to know, to learn. What you appreciate, I may not appreciate. Or so avoid all these subjective words to appreciate. Like that, you should not use these type of words when you write the objectives. Always, well, see, the type of word what you use again depends whether you are doing a descriptive study or analytical study. If you go, we cannot go into the detail because of the constraint of times, okay? So, straightforward, define the terms clearly. This has already been emphasized previously. Use simple language and don't overcomplicate the sentences. What all I have told is there in there, okay? Don't confuse the length with the quality. So when you do the next step is literature review. After the introduction part, next comes the literature review. Literature, as much as possible, you have to review, both Indian as well as abroad. See for the literature. If some studies have been done in abroad and not done too much in India, then you can pick up that study, provided it is applicable for our population. Is it feasible and is it well within your limits? You can select that area. Okay, that is also there. Because India nobody has done, I will not do. It's not like that. Okay, you can do that. Fine. So it's not just when you do the literature search, it's not that you just write so and so et al. Authors told this, this author told, he did that, he has mentioned that, she has mentioned that, they have mentioned that, that's why I am also mentioning. It's not like that. They have mentioned, they have done, you have to analyze that. It's called critical thinking. Critical thinking is important. See 10 articles and do the critical analysis. That's why the journal clubs and all we do in the medical colleges. The main analysis is not to tell that they were wrong. They were right in their own way. But are we able to do the same thing in our setup? This is what we are interested. That is only called critical thinking. And try to synthesize new ideas or from those articles or from those journals or from that this one. Try to synthesize, create insights. So create an insight from the given this one. So these words all look very going above the head or something like that, but this is how it should be. Okay. Only thing is, do lot of research before starting the research. Okay. Research means what? Do the literature search, find out lot of things, what they have left, what you can do, all those things. Okay. Don't just present. He told like that. I told like that. I am telling like this. What is that? It's just combining us. Okay. This already I have told you. Synthesize the information rather than just quoting the information. Then when you are citing the references, cite it properly. In the introduction part, you can cite the references. Materials and method part, you don't have to cite any references. Next comes the results. Next comes the discussion. Last comes the conclusion. If possible, write the limitations in the end. Okay, this is how the structure goes. In the initial structure, I had put that. Okay, first introduction, then review of literature, then materials and methods, where you are going to do the sampling, all those things. I am not going to detail of that. Then you get the results. What results and what is the difference between results and discussion? Results is what you have got based on your findings. Discussion is what you are going to interpret that in comparison to the existing literature. Okay? In the discussion, you will be again starting quoting citing all the references. Introduction, you had cited some references. Again, the references citing will start in the discussion part. In between, it is absent. Okay? In review of literature, it is there. Materials and methods, it is absent. Okay? That's how you should, and in data presentation, use proper, clear tables. Okay? Graphs and charts. And all these graphs and charts, what you are putting, should all be, see, all this should be directed towards the research question itself. That's why I told, write a research question and keep posted on your wall. Okay? Don't use some data which is not at all relevant. Unnecessary also. Unnecessary data will confuse you also, confuse the reader also. Okay? That is not the table. And every table, whatever you write or graph, just write a proper, if you are putting a graph, figure 1, figure 2, and schematic representation or diagrammatic representation or pie chart, whatever it is, you just label it accordingly. Okay? And always either give a heading or below. First part of the decision will have all these tables, list of tables and all those things. There you can make a mention of that. Okay? So sometimes we start with some research topic. Ultimately, we should not keep on putting our ideas into that. Okay? Whatever the results come, you should be ready to accept those results. Okay? So you should not once you have written the first draft is not always a complete draft. Okay? So you have to write down. You have done all the review work, everything, you have write down. You have to revise it. So best way of revising it, first you read it, then you write it. then you revise it. After revising, it's better you take the opinion of your peer group, or you take the opinion of your guides, or somebody who is more interested academically in the field. Never hesitate to take opinion, because the person who sees that draft, or not a final draft, the initial draft, they may have some ideas. You could have done this, you could have added that, you could have left out that, something they may tell you. So always be open for criticism, no? Okay, criticism means a healthy criticism. Okay, then you refine, again you write. Okay. So these are all just again the repetition. I don't want to go into that. So these are the headlines. Choose your topic properly. Then what's required of you, why you are doing this work. Do the in-depth search. Wrong thesis statement or a question you do. Read it, edit it, taking the help of your peers and seniors and guides, feedback, and then you final submit. 2 minutes, if sir allows me. These are the common pitfalls which are already mentioned. Procrastination. Procrastination means what? You wait till last time. ಒಂದೂವರೆ ವರ್ಷ ಇದೆ ಮಾಡ್ಬೋದು ಆರಾಮಾಗಿ ಮಾಡ್ಬೋದು. There is no aram. Aram haram hai. Okay? Okay? So start early. You will reach the goal early. Quality will improve. Okay? Don't take a very high ambitious or very weak research question, and don't get disorganized in your presentation. See, one paragraph should follow, the other paragraph will follow the first paragraph. There should be a consequently, subsequently, as a result of, therefore, that word should be used. So that the reader who is reading the first paragraph should feel like reading the second paragraph. You understood? Hope you are understanding. Okay, I am telling it in a very, though I am a surgeon, I have come to the community medicine level. Okay, it's okay, no problem. So we are all volunteers, okay? Going out from the chosen topic, plagiarism, sir will going to talk to you. Sometimes what happens, sometimes even without your knowledge also some data would have crept in, copy and paste would have occurred. So that should not be, and moreover when you are selecting the resources, don't restrict to 1 or 2 books or 1 or 2 papers. Go and search for a larger database for your, this one. These are the pitfalls what you see. You have to revise the initial drafts, don't fail to do that. And reference style, what our university tells is Times New Roman, 12 size, 2 spacing, double spacing. Okay, this is what our RGHS has told. Different universities may have a different format of presentation. Carry the same font size throughout. Okay, if you are using Calibri, you are using Arial, Black, all those things. Just use, our university says Times New Roman, 12 size font, along with 2 spacing, double spacing. This is what is required. Hope I have made it clear. Okay, make a consistency. And some universities also tell there should be a specific word limit for the 2,500, 3,500, something like that. If it is for papers, it is definitely given in the journal, whatever you are doing. And don't give a very vast conclusion. Without a conclusion, it's of no use. So with these few words, the final verdict from the, it's not Supreme Court, it's from the IMA. Stay organized, stay focused, stay proactive. Okay? Happy investigation and research. Thank you. If you have any questions, we'll answer in the panel discussion.
Thank you so much, Dr. Muhammad Arif sir, for your insightful and thought-provoking speech. We deeply appreciate the clarity with which you highlighted the common challenges and how best to navigate them. Thank you, sir. I now invite Dr. Ramachandra Badami sir, Vice President, IMA Shimoga, to present a token of gratitude to Dr. Arif sir. I welcome Dr. Arif sir to the stage. It is now my privilege to invite Dr. Vikram S. Kumar, Professor, Department of Pediatrics, Subbiah Institute of Medical Science, to speak on the topic transforming a dissertation into a journal article, adapting and refining your work. Sir's insight will undoubtedly be of immense value to all aspiring authors among us. Welcome, sir.
Thanks. Okay, can I have some, before I begin, thanks Dr. Sridhar, Dr. Priya, Dr. Srikant for this opportunity, and also opportunity for these postgraduate students. Believe me, I have to confess beginning that none of the theses I have not published. Dissertations or thesis that we were made to do was crap. So looking at you, I feel FOMO. What is FOMO? Yeah, fear of missing out. Yeah, I mean, if you look at, if you want to discuss this topic, our journalists have published a dissertation as an article, probably 20-30%. I can vouch for it. Nanjote madiro Mumbai Pune publish madila. Because it was so difficult. As rightly pointed out in the beginning, introduction by Dr. Srikant, opportunities are plenty. You can really utilize the opportunities that you have to come out with good publications. Also made easier by the fact that there are thousands of journals now. When we were, there were hardly few journals. When we talk of publishing in a journal, ensure that these journals are published and indexed in either of these two indexing agencies. One is PubMed, the other one is Scopus. Okay, so ensure that whatever articles you are publishing from the dissertation, that those journals are indexed in these two, or either of these two. Right. So now, yes, jana illi Subbiah anda irodu. How many of you are from Subbiah? Oh, most of you are from Subbiah. How many of you are from SIMS? Right. So for those who are from Subbiah, it may be a repetition of certain things. Nevertheless, it will be reinforcing. So then I would request all the ones from SIMS to come here. Hinde alvo, he left the. Those from SIMS, please come and sit here so that we'll have some sort of interaction here. I just want to know, in SIMS inda bandiroru, how many of you are from the final year post-graduation and how many of you are from first year post-graduation? Yeah, come here. I mean, we'll just try to have some chat so that we'll get ideas. So you all are from? Huh? Yeah, all of you are from Subbiah. Ilbani, I think you can. You are all from first year or second year? First year, very good. All first years from Subbiah also can occupy here, the front seat. So all of you are from first year, right? Okay, from across the departments. Huh? Better. So Arif sir idaranta hudukondu. Anyways. You've still got time. All the first year students, yavatama last date? When is your last date for some? 30th of? No. Synopsis, no, not the third years. First years yavaga? No, come on, yaar, we are having synopsis andre years. When is your last day? When is your last day for submitting synopsis? Huh? So you have time. So why I'm asking you this is, one, choose a topic which sure that you will be published. That is number one. You have to choose a topic which has got some potential to publish. Final year or yaar idhar ille, apart from you three, other departments? No final year students. Anyways, final year students, if you are there, I've already shared it with my students. ICMR, STS, or you can go back and give these inputs to your colleagues. The ICMR, STS, second and third year students, they can start writing or publishing. Did you do some homework on that? Not yet. Before you finally publish it or send it for your thesis review, dissertation review to the university, ICMR allows you to publish it in its domain. You can send it. So still there is time. I think May 30 vargu time ide, so we'll have to start working on it. Second year students, who, if they were there, they would already be having an opportunity to publish in WHO projects. I've made these people do that. Adyavadamada WHO project. So whatever thesis you're working on, the same thesis you can start publishing for, or you can take synopsis of it or excerpt from it and start writing it for WHO projects. That I've made them do. See, getting selected or not is secondary. At least while you're doing 3 years of your clinical work, some amount of academic work needs to get translated into these kind of activities. WHO gives you Young Investigator Award, ICMR gives you Young Investigator Award. There's so many other agencies that will give you Young Investigator Award, especially girls, women, you have a lot of scope. Women Young Investigator Award, Women Young Publisher Award, so you'll have to keep a track of it. So if I have to share a little bit about how we go about in our research department in Subayanalli, we try to tag first year, second year and third year so that it becomes very easy. Or we also try to integrate horizontally. Horizontally in Tandri, all of you are there, no? All 6, 7 of you are in surgery. So what we try to do horizontally hege integrate ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ we take one topic, ಅದರಲ್ಲೇ subtopics ತಗೊಂಡು thesis ಮಾಡೋ, so that you will have a strong, you can work with each other, collect data and publish separately. And after you do that, once you have your juniors, you integrate with them vertically. That is not very difficult at all. ಈಗ ನಮ್ದ್ರಲ್ಲೇ ತಗೊಂಡ್ರೆ ಈಗ second year what we have done, what is we have chosen diabetes. Diabetes nalli we have chosen different domains in that in a single topic, so that they can, when it comes to collecting data or blood samples or whatever, everything can be done in a single blood sample. If you want to particular procedure or particular outcome, you would choose one or two and then all of you work on that, but under different domains. So that will be useful. Avag enagatte, you can all of you again come back together during your internship or rather final year, after you've given your exams, and then start publishing. In fact, namdralli nam students, they have done, you have to have a team. First of all, you have to have a team amongst yourselves, and also you will have to gel with your mentors and co-guides. We have a policy that we have one guide for student and 2 co-guides, so that we have a team of 4. And because we have integrated like this, they have more people as co-guides, so they can fall back for any sort of any of these co-guides. We regularly have these. By the time they publish or give it to the university, you would have presented how many? 5, 6, 7 times. So every time, at least yearly 2, 3 times, if you start publishing, ನಿಮಗೆ ತುಂಬ mentoring ಬೇಕಾಗಲ್ಲ. So ensure that you are after the guides and co-guides to have your own reflection of your thesis. It should not happen that it comes from the department or from the research committee that do this, do that and thali. If you are actively participating, if you go and ask your own guide, co-guide, sir, we want to discuss with you the progress anta helidre, it will be easier. Difficulties. Okay. What you have to understand, the topic workshop is how do you ensure whatever you have done during 3 years of dissertation, how can you publish it? So dissertation is different and article is different. Dissertationally, you will write 100 pages. Right? So you write 100 pages of dissertation, but ashtunu condense ಮಾಡಿ, you'll have to write it as an article. So you have a lot of scope while you are doing the dissertation. You need not have to wait for the entire dissertation to get over. And that is what Amulya did. That is what Shashank was doing. So you need not have to wait for the entire dissertation to get over. As soon as you collect some data, start publishing it. No. Adukunu kuda, if you are behind your guide, if you are behind your co-guide, it will be easier for you to publish. You will not have any latent period at all, because your guide or co-guide will already be knowing which are the easy journals in which you can publish. And obviously, they would be knowing whether this journal is indexed in PubMed or Scopus. This is important. 50 of you are there, not all 50 of you will enter a medical college. Maybe 10% of you may enter into a medical college. So medical college nalli academic appraisals, research appraisals have some publications. These publications need to be from these, need to be indexed in Scopus or PubMed. Of course, NMC also has given permission, yavado bere bere ella ide. The DOAG and MLA, yavado ide, Web of Science, not too sure, but these two are the ones that are recognized across the world. So, if journal yavade publish madadidrunu kuda, that article, look at that journal whether it is in PubMed or Scopus. So, audience for your dissertation is different, audience for your article is different. Finished your dissertation, probably apart from you, your guide, co-guides, and probably the reviewer would have read the entire thesis. Where article atharalla. Article, if it gets published in an article, audience is large. Especially if it gets published in a good journal, the audience is large. So, adhikoskara you may have to scale down or scale up your ability to convert your design into an article. So, the differences. There are a lot of differences between what a thesis or dissertation is and an article. So, the main difference is that your thesis or dissertation is a bulky output, whereas your article is a very succinct, to the point output. Aita. So, why have I put up this PowerPoint slide is that you have opportunity in your single thesis to come out with multiple publications, multiple articles barbodu. Okay, so when you are choosing your dissertation, choose those topics that are maybe what are called as thrust areas under ICMR. Aita, ICMR, there are certain thrust areas on which, if you do your dissertations, the chances of it getting converted into a research project or chances of it getting into an easy publication is higher. So what are the thrust areas? ICMR, what are the thrust areas? I'm just citing ICMR because that is the most user-friendly organization that we have. So what are the thrust areas in ICMR, under ICMR? Broadly, they classify NCDs. What are NCDs? Non-communicable diseases. You have CDs, that is communicable diseases. The other one is maternal and child health. So, I don't know what surgery, I don't know. Yadu sir, surgery thrust areas. I can talk of pediatrics, medicine and all, but surgery I don't know. Surgery probably thrust areas nalli, NCDs nalli, I think cancer surgeries and it barbodu. I'm not too sure. So yeah. So oral cancer is shared by many. Dental utogotare, head and skull based surgeries, yellaru togondbirtare. So that is up for grabs by everyone. So surgery, I'm sorry, I don't know. You'll have to ask Dr. Arif. For medicine, you have broadly, or any medical branches, you have broadly NCDs and CDs. So NCD nalli, non-communicable diseases nalli, The top, which is now making a lot of noise in ICMR across all the other funding agencies, is stroke, cerebrovascular disorders, and then epilepsy, then autism, ASD, that is autistic spectrum disorder, ADHD. Then you also have cancers, oncology. So istu NCDs thrust areas. Communicable diseases HIV, and all of you people have got so much of scope. Government setup, you have functioning in NACO or ART center, tuberculosis, HIV, AIDS, dengue, KFD, as Dr. Balu said. Lot of scope. So think along those lines. Coming to maternal and child, it is peripartal care. HIV, HIV exposed, but what is that? HIV exposed, but uninfected kids. Amazing scope there. So HIV in pregnant women, HIV exposed, but uninfected babies, and peripartal analgesia. So these are all the thrust areas in maternal and child. So when you are choosing a topic, choose from these topics. So it will be easy for you to of getting into any research project by applying for funding agencies later on, or publishing it easier in these journals. Funding agencies, there are many funding agencies in this country, and the ones that are accessible to us are ICMR from government, and some departments in Ministry of Health and Family Welfare. Then some private agencies like Bill and Melinda Gates Foundation. So all these, whatever the funding agencies are, these are thrust areas. So go back, you could just type ICMR thrust areas or field of interests on Google, you will get a list. It's not just that once you have a thesis done, you have to publish it as an article. Do you want to know what is the objective of doing a dissertation? I mean, the first objective is for you to get yourself a certificate of completion, MD, MS, whatever, and then if you're really good, if you're really motivated, if you're really for the community, then whatever you have done should translate into some workable solution for the community. May not happen with all the students. When you're using your dissertation, it is not that you will have to convert your dissertation into an article only. You could write posts of it, because if you look at the overall readership of scientific materials, it is not the journal articles that are read the maximum across the world. It is the blogs or podcasts. You can your own podcasts. How many of you have used Notebook LM here? Anyways, I mean, before I forget, I'll tell you, you can go back and talk to your colleagues. We will be having a conference at Subbaya on June, June, exclusively for you guys, postgraduate students and undergraduate students. So you'll have sessions like this. I mean, we'll try the maximum from our side to make you guys street smart. Once you get your degree, how street smart you can become after you get out of your PGs. That is the theme that we have. June, all of you can attend. It will be very useful, I feel, because we are trying to have some sessions wherein they'll empower you to be the better self of yourselves. Okay? So you could write blog posts and also zines. That is the thing that is doing rounds. What are zines? Homework or hostel work. Go and find out what zines are. Look at the worldwide medical education units. This is what they tell you, what to do with your dissertation. This holds true even for PhD scholars and also for all the medical postgraduate students who have come out with dissertation. So what to do with that? This is a structure. You extract, you condense, adapt, and then apply. You take your dissertation and apply these principles, and you can come out with articles. We'll just try to run through what this individual structure is. So, what do you extract? Could extract from, you would be having a lot of outcomes, no? You could extract in those outcomes that you have got from your dissertation, you could prioritize the most important outcomes and then identify 2, 3, and just try to write papers individually on these outcomes. So extract. Then condense. So if you've already done this job of choosing your dissertation topic from these thrust areas, it would not be difficult at all for you to condense and write. If you have chosen a very vague topic which is not relevant locally or nationally, you may not be able to do so. In that case, you may have to just condense it and write it as a simple review. You may not be able to write it as an original article. Because if you are trying to publish an article, there are different types of articles. Now, what are the types of articles? What are the different? This is otherwise, what are they going to publish if they don't know what are the types of articles? What are the types of articles? Have you ever touched a journal? Huh. So in journals, what are the different types of articles? Huh? What is this, yeah? Case report? Original article? Brief research article? Letters to editors? Huh. Have you heard of these things at all? No. None of you have heard. If paper, you have the first page, you have page 3, you have commerce, you have regional, you have international, you have sports, you have fashion, right? So similarly, in journals, if you take up a journal, you have different types of articles. What are those? You have the president desk's article, you have the index, you have the original articles, you have review articles, you have systematic review articles, you have meta-analysis articles, you have case reports, you have case series, you have an advertisement section. So all these things. So you'll have to choose what exactly to write or convert your dissertation topic into. So you could convert it into an original article, you could convert it into a review article, you could convert it into just a case series, you could convert it into just what else? Huh? Letter to the editor, excellent. So that, see, you have to understand is ultimately the strength of your publication, whatever the article, how do you know the impact of that article? You publish an article in the journal, no? How do you know whether this article has been impactful or not? Yeah, but Andre, how do you know? People may lie to you, no? ಓದಿದೀವಿ ಅಂತ ಈಗ ನೀವುಗಳು ಮಾಡ್ತಿರಲ್ಲ, ಅಲ್ಲ ಮಾಡಿದ್ದೀನಿ ನೋಡಿದ್ದೀನಿ ಅಂತ ಹೇಳ್ತಿರಲ್ಲ, ಹಂಗೆ ಸುಳ್ಳು ಹೇಳ್ಬೋದು. But how do you know what is an objective parameter to say, yeah, this has created some impact anta? Excellent. So, citation. How many times your article has been used to write another article? So, citation. Aita. So citation is what you will have to ultimately aspire for. So, same thing, how to expand. So, you have written on dissertation and you don't know what to do with that dissertation. So, there is a famous joke, no? ಎಕ್ಸಾಮ್ ನಲ್ಲಿ ಒಂದು ಹಸು ಬಗ್ಗೆ ಬರೆಯಕ್ಕೆ ಕೊಟ್ಟಿರ್ತಾರೆ, ಏನ್ ಬರೆಯೋಕ್ಕೂ ಗೊತ್ತಿಲ್ಲ ಅವ್ನಿಗೆ ಹಸು ಬಗ್ಗೆ. ಹಸುನ್ ತಗೊಂಡೋಗಿ ಮರಕ್ಕೆ ಕಟ್ಟಾಕ್ಬಿಟ್ಟು ಮರದ ಬಗ್ಗೆ ಬರೆಯೋದು. You've heard that joke? Those who don't understand Kannada, I'm sorry. I can't tell it in English. So expand antandre, when you have chosen a topic of dissertation which doesn't really make too much of sense, then choose or try to expand certain things, certain important things that you feel, and try to expand it to an extent wherein you can write it as a review or letter to same expand and adoption is more or less. So, whatever you have written, whatever, these are the questions that you'll have to answer for yourself. Going to be interested in whatever you have done. Now, if your objective was only to get a certificate, if your objective was to ensure that your guide is happy, your co-guides are happy, or the person who is a peer reviewer who says everything is already, if your audience is only, then your ability to scale up will be poor. ಆಯ್ತಾ, ಸುಮ್ಮನೆ ಎಕ್ಸಾಮ್ ಪಾಸ್ ಮಾಡೋದಕ್ಕೆ ಎಕ್ಸಾಮ್ ಸರ್ಟಿಫಿಕೇಟ್ಗೋಸ್ಕರ ಅಂತ ಡಿಸರ್ಟೇಷನ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಅಂತಂದ್ರೆ ಯುವರ್ ಎಬಿಲಿಟಿ ಟು ಸ್ಕೇಲ್ ಇಟ್ ಅಪ್ ಇಸ್ ವೆರಿ ವೆರಿ ಪುವರ್. ಹೌ ಡಸ್ ಇಟ್ ವಾಟ್ ವಿ ಆಲ್ರೆಡಿ ನೋ? ಅದಕ್ಕೋಸ್ಕರ ನಾವು ಟೇಕ್ ದಿಸ್ ಅಪಾರ್ಚುನಿಟಿ ಟು ಗೋ ಬ್ಯಾಕ್ ಅಂಡ್ ಸ್ಟಾರ್ಟ್ ರೀಡಿಂಗ್ ಜರ್ನಲ್ಸ್. ಇವಾಗ ಇಫ್ ಯು ಲುಕ್ ಎಟ್ ಗುಡ್ ಜರ್ನಲ್ಸ್ ಅಕ್ರಾಸ್ ದ ವರ್ಲ್ಡ್, ಐ ಮೀನ್ ಈಸಿಯೆಸ್ಟ್ ಫಾರ್ post graduate students, I would say look at BMJ publishers, that is British Medical Journal publishers. They have very good user friendly, reader friendly articles. So any journal article in BMJ, at least if you open, they will have at the beginning, apart from abstract, important column, what is known, what is already known, what this study adds anta. So our question kuda you will have to ask. Novelty alla, novelty is different. If for example we don't know so many things, for example we eat thrice a day, no, yaar helkottidare namge dinಕ್ಕೆ 3 ಸಲ ತಿನ್ನೋದಕ್ಕೆ? There is no written rule anywhere that we have to eat thrice a day. It could be as simple as that. ನೀವು ಹೇಳ್ತೀನಿ, ನಮಗೆ ಹೇಳ್ತಾ ಇರೋದು, you please eat 3-4 times a day because you are working so much. So the question could be as simple as possible. Andre ataranu kuda, how significant is your message, your findings? Yeah, so the most important is the question number 1 and question number 2. Who is going to be interested in the work you have done? Andre you need to try to woo the audience, find out the audience. Then you will have to target the journal. ಯಾವ ಜರ್ನಲ್ಗೆ ಹಾಕೋದು? So ಅದಕ್ಕೋಸ್ಕರನೇ if you have a good rapport with your guides, co-guides, mentors, research department, they would help you. ಇದು ಈ ತರ ಮಾಡಿದ್ಯಾ, ಈ ಜರ್ನಲ್ಗೆ ಹಾಕು, ಬೇಗ ಪಬ್ಲಿಷ್ ಆಗುತ್ತೆ. ಇದನ್ನ ಮಾಡಿದ್ಯಾ, ಇದನ್ನ ಈ ಜರ್ನಲ್ ಕ್ಲಬ್, ಈ ಜರ್ನಲ್ಗೆ ಕೊಡು, ಬರೀ 5,000ದಲ್ಲಿ ಪಬ್ಲಿಷ್ ಆಗುತ್ತೆ. So you need to know that. Ultimately, ಯಾಕೆ ಗೊತ್ತಿರಬೇಕು ಅಂತಂದ್ರೆ each journal has got its own submission guidelines. ಆಯ್ತಾ? ಸೊ ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಟ್ ಡಿಸರ್ಟೇಷನ್ ಪಬ್ಲಿಷ್ ಮಾಡೋದಕ್ಕೆ ಅಂತಾನೆ ಕೆಲವು ಜರ್ನಲ್ಸ್ ಇದೆ. ಜರ್ನಲ್ ಆಫ್ ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಟ್ ಮೆಡಿಸಿನ್ ಅಂತಾನೆ ಇದೆ ಇಂಡಿಯಾನಲ್ಲಿ. BMG ಅವ್ರದ್ದು ಜರ್ನಲ್ ಆಫ್ ಪೋಸ್ಟ್ ಗ್ರಾಜ್ಯುಯೇಟ್ ಸ್ಟಡೀಸ್ ಅಂತಾನೆ ಇದೆ. ಸೊ ಆ ಥರದ್ರಲ್ಲಿ ದಿ ಚಾನ್ಸಸ್ ಆಫ್ ಪಬ್ಲಿಷಿಂಗ್ ಯುವರ್ ಆರ್ಟಿಕಲ್ಸ್ ಆರ್ ಹೈ, ಬಿಕಾಸ್ ಅದರಲ್ಲಿ ಅಂಡರ್ಟೇಕಿಂಗ್ ತಗೋತಾರೆ ದಟ್ ಯು ಆರ್ ಸ್ಟಿಲ್ ಅ ಪೋಸ್ಟ್ ಗ್ರಾಜ್ಯುಯೇಟ್ ಸ್ಟೂಡೆಂಟ್ ಅಂತ. ಸೊ ನಿಮ್ಗಳಿಗೆ ದುಡ್ಡು ಕಟ್ಟೋದಕ್ಕೆ ಬೇಕಾಗೋದಿಲ್ಲ. ಸೊ ಯು ವುಡ್ ಬಿ ಏಬಲ್ ಟು ಪಬ್ಲಿಷ್ ದೇರ್. ಸೊ ಐಡೆಂಟಿಫೈ ದಿ ಜರ್ನಲ್ ಇನ್ ವಿಚ್ ಯು ವಾಂಟ್ ಟು ಪಬ್ಲಿಷ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. This I told you. Ensure that the article that you are going to publish is the journal. Definitely either of two. PubMed. The NMC also allows you to do it in DOAJ. But DOAJ and all, nobody cares if you are applying for research project. It should be PubMed or next. This is your homework. So while you are sleeping, few of you could just open your eyes for about 10 seconds and then look at these topics at least. Go back and try to do some homework. Either you can read or just give us prompt to ChatGPT. Ask what is mentor, immediacy index, journal citation indicator, site score, Shimoga journal rank and Google Scholar H5 index. Ishtadru maadi. Why? You will get a theory question. ಅದಕ್ಕೋಸ್ಕರ ಹಾಕಿರೋದು. ನೀನು ಓದ್ಕೊಂಡ್ರೆ ಅಟ್ಲೀಸ್ಟ್ 10 ಮಾರ್ಕ್ಸ್ಗೆ ಬರೆಯೋಕ್ಕಾದ್ರೂ ಅಟ್ಲೀಸ್ಟ್. ಓಕೆ, ಸೊ ಗೋ ಬ್ಯಾಕ್ ಅಂಡ್ ಟ್ರೈ ಟು ಫೈಂಡ್ ಔಟ್ ವಾಟ್ ದೀಸ್ ಆರ್. ಒಂದ್ಸಲ ಓದಿದ್ರೆ ತಲೆಯಲ್ಲಿ ಉಳ್ಕೊಳ್ಳುತ್ತೆ. ನಾಳೆ ನಿಮಗೆ ರೀಸೆಂಟ್ ಅಡ್ವಾನ್ಸಸ್ಸು, ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸು, ರಿಸರ್ಚ್ ಅಂತ ಹೇಳಿ ಒಂದು ಪೇಪರ್ ಇದೆಯಲ್ಲ ಥಿಯರಿನಲ್ಲಿ, ಯು ಮೇ ಗೆಟ್ ದೀಸ್ ಕ್ವೆಶ್ಚನ್ಸ್. ಸೊ ಅಟ್ಲೀಸ್ಟ್ ಗೋ ಬ್ಯಾಕ್ ಅಂಡ್ ಟ್ರೈ ಟು ಫೈಂಡ್ ಔಟ್ ವಾಟ್ ದೀಸ್ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಆರ್. These are very common, but there is a solution. Is the solution responsible usage of artificial intelligence tools? What are the common mistakes we do? Not reviewing submission guidelines, incorrect formatting, wrong manuscript type, poor grammar, syntax and all. How many of you use chatbots? All of you use, no? Which is the chatbot you use? ChatGPT. What about you? All of you ChatGPT. Any other chatbots people are using here? Perplexity. Okay. GPT. You guys, have you ಕೇಳಿದ್ರೆ ಹೆಸರಾದ್ರು ChatGPT? Perplexity. What else? Llama. So you start using them. ChatGPT is to begin with is really good. Perplexity is very good for medical, as a medical chatbot. Claude also you can use for, especially for writing. CLAUD, Claude, for writing, writing your reviews, literature reviews, and also converting it into a small or condensing and all. You could use that. It's not difficult. Very easy. If you can use Instagram, Threads and WhatsApp, using these chatbots are very, very easy. Very easy, and you should start utilizing it. At least I have my own nieces who are doing MBBS and all of them have stopped. Textbooks will become degenerate, redundant in the next 2-3 years. No one is going to read textbooks. So you can start using chatbots for your learning, and also them for properly formatting, checking grammar and all those things. However, we can catch hold of those people who have only used AI to create the entire thesis, dissertation. It's very easy. Tools which can easily come up with, give you everything from which tool or from which AI tool this person has taken it from, what has he used. Everything can be picked up by plagiarism checking tools. So you should not be using AI chatbot. It should not happen that, okay, next week dissertation submit ಮಾಡಬೇಕು, chatbot ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟು ಅರ್ಧ ಗಂಟೆನಲ್ಲೇ ಎಲ್ಲ ಜನರೇಟ್ ಮಾಡಿದೆ ಅನ್ನೋದು ಆಗಬಾರ್ದು. People are doing it and it's very easy to catch them nowadays. So use chatbot, all these AI tools, in order to understand the question and then come out with proper outputs, and also for, of course, checking grammar, paraphrasing and rephrasing. But started doing, please don't do that. No using AI tools to for writing the entire thesis. No, can be easily caught. And it has made it very strict that if a student is caught or if the plagiarism check or cross-checking are showing that it is a predominantly AI generated, without any mercy that will be rejected, right? So that is one of the mistakes that just about 3 months ago got a DNB thesis review. More than 65% was AI generated. Last year, few RGHS dissertation, more than 90% were AI tool generated. So it's very easy for us to catch. So never use AI chatbots, AI tools to write the entire or cook up the entire dissertation. Very, very easy to catch. This again is a very important thing that most of us are underutilizing. Whatever you have published, whatever you have learned, use these social media tools to promote, propagate. We are not good at content creation. YouTube content creation, Daily Motion content creation, or Vimeo, any content creation we are poor. So our ability to translate whatever we have learned into educational material is very poor. We will have to work on ourselves. We will work on ourselves. We are doing so much of learning in order to just pass our degrees. But in what way can I translate my learning into educational outcomes? We are not working on it. Educational outcomes for patients, for lay public, for content creation, for content consumers, we are not doing a good job. Now, with all these free to subscribe, or freely available YouTube channels on how to create content on YouTube, how to promote, how to propagate, how to influence, all of you should start trying to watch this or do you self-directed, self-paced learning about how to go about improving the outcomes or educational outcomes. So I'll end by saying AI is a really useful tool. AI chatbots are really, really useful tools. I may be wrong if I call them tools because they are now because no longer LLMs. Chatbots, whatever you are using are LLMs, that is large language models. Now, probably in the next year, you will not have LLMs. They will all become agentic workflows. Anyways, so that's why don't know whether it's appropriate to call it as a tool. It's an agent. Agent antandre tool antandre you give a command and it does it. Agent antandre you give a command that comes back to you and says ee tara madidre chenagirutte anta. Or it itself understands you and changes according to your needs. So that is an agent. So we are there almost. It's an agent. So if you use AI tools, whatever we have discussed now, you could do it amazingly well with fantastic outcomes. You can become very, very street smart. And it's an opportunity that all of you will have to grab with both the hands and also both the legs. Because you don't know the influence that AI is going to have in the coming years, especially with respect to academic research and academic writing. So learn how to use responsively these AI tools and then ensure that you utilize it daily in your academic learning, academic research, and of course using the knowledge of academic research and converting it into proper publishing outcomes. Stop here. Thank you.
Thank you, sir. On behalf of all present, I extend our sincere thanks to Dr. Vikram, sir, for his highly informative and insightful address on this topic. We are truly grateful for the knowledge you have shared with us today. Thank you, sir. I now invite Dr. Vinaya ma'am to kindly come forward and present a token of gratitude to Dr. Vikram, sir. Now, it is with great pleasure that I invite Dr. Anupama YJ ma'am, nephrologist at Nanjappa Hospital, to speak on the topic navigating the publication process, journal selection, submission, and peer review. Ma'am's insight will be especially valuable for researchers seeking to successfully position their work in the right journals and navigate the peer review process with confidence. Let us welcome ma'am to the stage.
Good afternoon, everybody. Am I audible? First of all, I would like to thank IMA Shimoga, the team IMA Shimoga, for having this a wonderful program in the Vartan. Okay, that was all. I'd like to thank IMA Shimoga for organizing this wonderful CME on this important topic of how to conduct the research and then to navigate into publication. So, all this while you've been hearing people from academic institutions, and they have been following many students for doing that dissertation, and lot of inputs, valuable inputs have come from all of them. I stand before you as a person who is not directly into any academic institutions. I happen to go into the field of research almost by serendipity. I am a consultant nephrologist at Nanjappa Hospital, and after about 10 to 12 years of my practice in Nanjappa Hospital, I suddenly decided that I should be doing some research in community medicine. I did a project on community study of chronic kidney disease, and then I decided to venture into publication, and that's how my journey into the research started. And then onwards, it went on from one research to the other. And now I have got some inputs that probably may be of help to all of you. So I have been given 3 topics. One is how to select a journal, and how to submit the article to the journal, and how to and what happens after submission, what is the review process that goes on in the journal. coming to the journal selection, if you take, there are multiple journals in medical sciences alone, about 15,000 journals or more may be there in medical sciences alone. How to navigate, how to think of which research, which journal to select. So there are multiple questions to be answered, and I will try to give some answers to the questions. And now, Dr. Vikram has already told that there are so many types of articles. I would request all of you to go through the journals, first the index page, to see what are the different types of articles that are there in the journal, and to see what are the different ways in which articles can be presented. Although this CME is about publication, converting your dissertation to a publication, it is not necessary that you must have a dissertation to start with and then only go into any journal. Your publication need not start with dissertation itself. You, in your day-to-day work in the wards or in your labs or wherever you are posted, you can see definitely some interesting cases, some interesting slides, some interesting x-rays, if you are a radiology PG. So those things can be taken and converted into a simple research article to begin with. It is not necessary that you must complete the entire dissertation. As Dr. Vikram told, many of us have not converted our dissertation into publication. So it is not the only way. So how does it start? If you have, for example, an interesting x-ray, that itself can be taken as an pictorial CME, an important image in that field, particular field. Maybe you can go to a radiology journal and publish it, or maybe you can publish it in your own specialty journal. Some brief ideas about that particular X-ray or CT or MRI, whatever it is, that itself constitutes a publication. Letter to editor, very simple. Just in some 200, 300 words or 450 words, whatever it is, you can just concisely say what you have seen in the wards or what you have seen in your day-to-day practice. You can just collaborate with your professor, take the advice and make it into a letter to editor and start publication immediately, even if you are a first year postgraduate student. So it is not just converting dissertation into a publication. First of all, when you are thinking about the journal, you have to take some aspects into consideration. You have to look at the aims and scope of each journal. You have to do some research before going into the actual publication process. You have to do the research into the journals itself to know various things. What are the aims and scope of that particular journal? What is the indexing? What do you mean by impact factor or other metrics for journal metrics? Whether it is an open access journal or not an open access journal. What do you mean by article publication charges? And what is the article turnaround time? So these are some of the important aspects to be considered when you are thinking of publishing in a journal. Are you a regular journal reader? If you are a regular journal reader, definitely you will come to know what are the type of articles that are published in the journal. So you can easily make a list of what are the journals that you can send your article to. If you are not a regular journal reader also, in the process of your dissertation, you would have collected some reference works. So those reference works itself will tell you, if there are a lot of list of references, some 50, 60 references you would have collected in the process of your dissertation, those references will tell you where it is published, what is the journal which can take up this, your publication. So which journals will publish this kind of articles you will be coming to know. Now read the aims and go to that particular journal website, read the aims and scope properly, see whether your journal article fits into that, and make a list of all the journals. Now it's important to know what is indexing. Everybody from morning they were telling about indexing of journals and that it is important. There are PubMed indexing, Scopus indexing, and so on and so forth. There are a lot of indexing agencies, and a journal index is a list of journals which is organized by discipline. So while indexing a journal, the journal has to follow a certain set of rules. Only when you are fitting into certain standard only, the journal will be indexed. So it is if the journal is indexed, it is of a good quality journal. That is what you'll come to know. What do you mean by journal metrics? There are several scores for assessing the quality of a journal, just like an impact factor, site score, so on and so forth. So many, Dr. Vikram also already pointed out. But what is an impact factor? He has given you as a homework, but anyway, I'll tell you here that impact factor is a measure that measures the frequency with which the article is cited over the past in that particular year. So it is calculated by as like this. If you want an impact factor of a journal in that particular year, over the previous 2 years, how many the citations to the articles that were published in those 2 years constitutes the numerator, and the denominator is the total number of articles that are published in the journal over the last 2 years. So if you have a large number of citations to any particular article, the journal will receive a high impact factor. So it is important to publish in a good impact factor journal because it improves the readability, readership, visibility, improves the academic credibility, improves your grant receiving ability, and improves your promotions, improves so many things. So it is always better to publish in a high impact factor journal. So this is just a list of high impact factor journals in the year 2024. You can see that it starts from 254, that is the CA, a cancer journal for clinician. These are the top 10 journals which have been ranked. So, do all journals have impact factor? You may ask me that question. It is not that all journal factors have impact factor. There are many Indian journals, or many other journals, not just India, many other journals which do not have impact factor. It is very difficult to have an impact factor in the early period of the journal development. Say first year, second year, third year. You may not get the citations necessary. For the impact factor, at least 2 years you must have completed. I already told the numerator, for 2 years they consider the articles. So it is for an early growth journal, it will be not having an impact factor. If the journal has been there for many, many years, like New England Journal of Medicine, Lancet, which has been there for years together, then they will have, definitely, they are likely to have a good impact factor. Not to say that they will have, they do have an exacting standards to merit that impact factor. Some of the highest ranking Indian journals, look at the impact factor. It is 0.8, 0.8, 0.4, 0.9, 2.7. The highest impact factor of Indian journal is Indian Journal of Medical Research, brought out by the ICMR. That has an impact factor of 2.7. But don't be under the consideration that to bring out your article in that particular low impact factor, I mean, it's not a low impact factor, but whatever it is, compared to New England Journal of Medicine and Lancet, it is definitely not very high. But even then, to bring out your publication in this particular journal also, it is not a cakewalk. Definitely, you have to struggle hard. So you have to be realistic. It is not that just because you have an article, it's going to be published by any journal. So you have to, if you directly go to a high impact factor journal, you are likely to get rejected. So get your article, once you're prepared, get your article processed by, just ask your internal peer review in your department, the guide, co-guide, or among different colleagues. So to get the internal peer review to help it get better so that your chances of rejection is low. And make sure that you go to the right person. He should not put you down. He should pull you up, he or she. So now the next question is whether we should go to a specialty journal or a general journal, or whether to go to a national journal or an international journal. All this depends upon the type of subject that you have chosen for the article. If your topic is very, very regional oriented, it is highly likely that the international journals are going to reject it. For example, when I studied prevalence of chronic kidney disease in the rural population of Shimoga, I had to submit it to Indian Journal of Nephrology to get it published. If I had chosen, say, Kidney International or some other international journal, definitely it stands a chance of rejection and I'll be wasting my time. Now, there are many other qualities of a journal, like whether it is related to a particular discipline, whether it is related to in that also there are so many subspecialties. So all this has to be decided. For that, you have to have an in-depth idea about the articles that are published in the journal. Whether it is an open access journal or a hybrid journal. Now, this is also important consideration, because open access journals means that most open access journals, readers will not have to pay anything for the full text article. But the person who is submitting article, they may have to pay, especially if the article is a high impact factor journal, then it is likely that they will be having to pay a hefty amount of article processing charge to cover the fees. If it is a closed access, the reader will have to pay for it might be behind a paywall, so closed access is different. Now, hybrid journal is one wherein some articles are open access, some articles are closed access. So you may see in a journal some articles have a marker to say that it is open access. Now, what do you mean by article processing charges? Article processing charge is a fee that is levied on the person who is submitting the article for processing that has to be carried out in the journal for the production. And in some journals, like high impact factor journals, generally they have high APC, which is out of reach for most low middle income countries like us. So unless you have a funding body which is funding your study, it is unlikely that you can publish in such journals. Now next we'll go to what is a predatory journal. Sometimes, especially when you start publishing, then you'll get mails from different journals asking for your article. They say, very nice flowery language, they say that, okay, you have published in such and such a journal, we are happy to publish similar articles in our journal in a very short period of 1 week or 2 weeks or whatever it is. So that is, nobody is going to, if it is a true journal, nobody is going to ask for your articles in that way. So fake journals or counterfeit journals are those journals which will ask for the articles directly, entice the authors to publish in their journal for a fee. That fee will be hidden. They will tell later, only after you agree for everything and do publish, send the article, then they might tell you that this is a fee involved. That will come later. So there are something, it is important to know that there are something called predatory journals, and why we should not associate with any predatory journal, whatever the temptation. They might say we will publish it in 1 week, so it's very tempting for us to start thinking, okay, we'll send the article here. No, don't do that, because it will harm the reputation. Most of these kind of journals will not have very good reputation themselves, and if you get associated with those journals, it might harm your reputation. So how to spot a predatory journal? These are some aspects. They may claim to have high acceptance rates, they may claim to have fast turnaround times, they may show some big names in the editorial board who are not even associated with that, so on and so forth. So it's very important to spot the predatory journal and not be associated with it. Okay, so far this is the journal selection. But if you are still confused, then there is something called journal finder tool in most publishing houses. What you do is you put your abstract, copy paste into that journal finder tool, then that itself can suggest different journals to approach. So to summarize, journal selection is, you have to know, you have to read the aim and scope of the journals and see whether the journal is likely to accept your kind of article. Check the indexing, check the impact factor, consider the impact of other work published in the journal, and check the time to publication. There are some journals wherein you submit today, it's going to be published only 1 year later. So that every article will tell you the submission date, then the received date. submission date and the review date and the actual published date. So go through that to see how much is the time taken by the journal to publish. If it is a very long, lengthy time, then there is no point in trying to send your article to that particular journal. Okay, now coming to the second part of my topic, how to submit. Now once you have prepared the manuscript, Dr. Vikram already told what are the steps to be taken, and once you are ready with the article, you have to submit. But for that, you have to again go through all the instructions to the authors and prepare the manuscript. It is very important. If you have prepared the manuscript carefully, following maximum instructions, then the editor is more likely to pass it to the next stage. So these are some of the documents that are required. Covering letter, then the first page, the abstract, keywords, then your main body of the document, and tables and figures, and supplementary information, etc. So covering letter is very, very important in any when you are submitting to a journal, because you have to mention, you have to address it to the editor-in-chief, and you have to mention why you are submitting, why you are considering that particular journal for this article, what is the speciality of your journal that you think what is the value of your journal, value of your article, what you think may be useful to the readers of that particular journal. And also tell which type it is being submitted to, whether it is for an original article, whether it's for a letter, etc. And also it should contain a declaration that it is not submitted anywhere else. Why? Because you can't you prepare an article and submit it to 10 journals at one time. You have to go step by step, take every journal, and then it goes through the process. If it is rejected, then you can consider another journal. So at the same time, don't think of submitting to many journals. So the first page will have all these things. I'll skip it for the want of time. Now the most important part of the article is preparing a proper abstract. The instructions to authors will tell you whether they require a structured abstract or an unstructured abstract. A structured abstract is one wherein they have, in different divisions, you have to prepare it: background, aims and objectives, then the methods, results, and conclusion. So this constitutes a structured abstract. An unstructured abstract, you have, like for example, a case report. You don't have to prepare methods for that. You can just make a short summary of the case report and make it as an unstructured abstract. Then it is very important to write it clearly and unambiguously, and also make it very concise. Whatever you want to tell in the entire article should come in the abstract. The editor is going to read that first. He is not going to read the entire article. He is going to read the abstract and then decide whether it should be considered for further review or not, whether it can be rejected immediately. So if the abstract doesn't have all the details, highly likely that you are going to get rejection letter. Also, the readers, when they are reading, if you take a journal article, you read journal, when you're going through the journals, you are likely to read only the abstract. Many a times you are not going to read the entire article. You just read the abstract. Okay, this is the point that they are making. So this is the conclusion. This is what you are going to imbibe. So having a well-written abstract is very, very important when you are considering a publication. You also have to make a list of keywords. Keywords are those words which help you in searching for the article. If they put keywords like, say, chronic kidney disease, prevalence, epidemiologic study, Shimoga, then it should directly lead to your article. Similarly, so just they help in categorization and indexing as well. So that is very important. Now the next is the main body. Dr. Arif made a mention, double spacing. Not only in thesis, it is also important to have double spacing in all the article. It helps the editors and the reviewers to read it. Readability is very, very important. If they have an eye strain reading your article, definitely it doesn't stand a chance. There are some declarations also. Dr. Vikram touched upon it briefly. Now to reference. reference should be written as per the instructions which are given in the instructions to authors, and mostly they usually prefer a AMA format or a Vancouver style that you can just go through. That's again homework from my side. Okay, now figures and tables. This is another important aspect. You cannot just jumble up the entire article, put the figures wherever you like, put the tables wherever you like. It is not like that. Most journal articles will prefer to have the tables at the end of the entire article. So when you're submitting, they may later change the position, put it somewhere else, but you have to put the tables at the end of the article. And the figures have to be submitted separately as a different, because the resolution and the clarity will be lost if you are going to submit in the same page or MS Word, the Microsoft Word, then it's going to be, it will not be maintained. So you have to submit it separately as a JPG file. Then it's important to have figure legend. What exactly you're trying to show in that figure, that should be written. For example, if it is a slide, I mean, if it's a pathology slide, then you have to write which stain it is, what you're trying to, what biopsy it is, what stain it is, what magnification it is. All that should come. And if it is an X-ray or a CT or an MRI, then you have to tell what that is, contrast film or plain film, what does it contain. Then tables, charts also, similarly, you have to see that all the marking is done correctly. Okay, now that you are ready for submission, most journals will have an online manuscript tracking the submissions area where you have to register, and then you have a copyright form which you have to, copyright form will be sent to all the authors of that particular article. So you have to have a clear idea how many authors are going to be there for your article. It is not that you alone can write. Definitely you would have taken the help of your professor or any other faculty, or the other co-authors will be there, your friends will be there. So all the names should be included in the online manuscript tracking system. Why I am telling this is, once you have made this, the copyright form will be sent to all the authors and they all have to sign, otherwise it's not going to be published. Now the third part of my talk is on the what happens after you publish, after you submit. So the editor is going to get your article, and in big journals, editorial review, there will be some members for doing the editorial review. In our journals, we only do it. We have to see whether the manuscript is completed in all aspects. If there are deficiencies, then we send it back for technical modification. And then again, you have to do the correction and resubmit. Once the editor is convinced that it is okay, now the peer review starts. 2 reviewers will be assigned. Sometimes more also can be assigned in some journals. So once the peer review process starts, there can be either single blind peer review or double blind peer review or open review. Now I'll leave that to, because of the shortage of time. Why do a peer review? Why should we send it for peer review? The peer review is done to help improve the quality of the article and improve the readability, and maybe some aspects will be put in by the reviewer to strengthen this portion, strengthen the introduction portion, strengthen the discussion portion, or discussion is not done correctly, statistics is not done correctly. So these are some of the things which they are experts in those fields, so they will easily come to know what are the deficiencies in the journal article. And it is important to know that reviewers do it for, they are not getting paid for that. So none of the review article, when we review, we are not going to get paid for that. So we are spending our quality time on the review. So please understand that they are doing it to improve the quality of your article. Now go through the comments of the reviewers and do the revision accordingly. If you are happy with if you are agreeing with the reviewer's point of view, you correct whatever they have suggested. If you are not agreeing, if you feel that reviewer has not understood what you meant by that, then make a justification in your reviewer's comment. You have to send a point-by-point rebuttal. So the reviewer has made points, this point, okay, this is where I have changed it. Okay, then you resubmit, and after that, okay, so this is a summary of the peer review process. The author submits the article, the article is seen by the editor, and at the same time, if the editor feels that it is not worthy of publication in his journal or her journal, then it goes called desk rejection. It undergoes rejection at that point itself. Otherwise, they may send it to the reviewer. If the reviewer has done the revision, suggested comments, then it will go back to the author. Author has to do the revision and send it to the editor again. Again, the same process will continue. Even after the revision, if the reviewer feels that it is not worthy of publication, then they may give a recommendation for rejection. So it can get rejected. Or if the reviewer feels that it is okay, now the quality of the article has improved, then they give a recommendation for acceptance. And then the editor also is likely to accept the article, or he may still have some other ideas. Anyway, but final result, when it gets accepted, it will go to the production house. What happens if the article is rejected? Don't worry, there is still hope. You can send it to another journal now with some suitable modifications. Whatever modifications were suggested in the earlier review, you can still send it to another journal, and still you can get your article published. So it is not the end of the road. If it is accepted, then it goes further processing in the form of author proofs, editorial proofs, and can get published. So this is how the entire publication process goes on. And I thank the organizers for giving me this opportunity to discuss about all that happens, and I hope it's of use to all of you. Thank you.
On behalf of all present, I extend our heartfelt thanks to Dr. Anupama ma'am for her insightful and highly practical address on navigating the publication process. We are truly grateful for your valuable contributions to today's session. Thank you, ma'am. I now invite Dr. Vinaya ma'am to kindly come forward and present a token of gratitude to Dr. Anupama ma'am. Now, with great respect, I invite Dr. Shrikant N. Hegde sir, esteemed consultant physician, to deliver his talk on the topic Ethics and Integrity in Research Publishing, Plagiarism, Authorship, and Responsible Conduct. His insights will be invaluable in reinforcing the core values that every researcher must uphold. Kindly join me in welcoming him to the stage with a warm round of applause.
Thank you. I once again thank the organizers, and I thank all of you for having been here all day long. I have a good news and a bad news to tell. The good news is that the program is coming to an end. The bad news is that I'm standing between you and the lunch. So I'll try to complete my topic as early as possible so that you can have a good lunch and we can have some interactive session before that. The topic which I'm covering would deal about the ethics and integrity in research publication. Okay, you have joined as first year PGs now. You have taken up a right topic as discussed earlier. You have made a wonderful study based on very good methodology. You have written a good paper, and you have sent a paper to a selected journal. The article also get published. In between, throughout a whole process, one thing which is very important is your conduct. How you conduct yourself as a researcher. It may not be very important at this point of time as a PG student doing a thesis, but as you move up in life, when you assume higher roles in research and publication, these issues become very important. What are ethics? What do you mean by ethics? We hear everywhere medical ethics, professional ethics, etc. It comes from a Greek word called ethos. Ethos means custom, habit, or even character. Ethics are a system of moral principle which define what is good for individuals and society. So basically, to say you are following ethics means you are following something which is good for you and good for society. So that is the basic meaning of the word ethics. So it's understood that when we do a research, whether the research doesn't mean that just doing a research as well as publication, we do it ethically and we conduct ourselves responsibly. Why ethics is important in research is, we remember that most of the research we do in medicine is on human subjects. When we do research on human subjects, we have to respect the fellow human beings who has volunteered to participate in your study. So following ethical principle is very important. You should also consider the safety of the individual. You should not do any harm to the individual. And the research whatever research you do impacts the healthcare in terms of better treatment, in terms of better diagnosis or management, or overall healthcare of the society in general. And the public should, and the professionals should trust your research. The research is taken for evidence, research is taken for formulating treatment guidelines. So unless the research is done with a good quality, ethically, scientifically, and with proper methods, the outcome is not transferable and not extrapolatable to the society as to improve the treatment in the world. This picture you might have all seen, a beautiful painting from Parker Davis, which shows Edward Jenner giving the smallpox vaccination to his child. That was in mid-1800s, 1750 or so, when Jenner got an idea of a smallpox vaccine, creating smallpox vaccine. He inoculated the cowpox vaccine to a boy called Philip. Philip was a boy who was playing in the garden. He was the son of the gardener of Edward Jenner. He just inoculated it and did the experiment on him. Good for the mankind, good for him, and good for Philip. The experiment was successful. But what we don't know from that time is there might have been many such experiments conducted on human beings which were not successful. They were not as fortunate as Philip or Edward Jenner. That would have resulted in bad outcomes. So that was the way how medical science evolved. We come to the beginning of 20th century, the early part of the 20th century, the part of World War. Most of the medical research was done on prisoners, patients who were mentally retarded, patients who were blacks, poor or marginalized section of the society. So those were the people, and sometimes even war criminals. We all know that during the World War or during the era of Nazis, most of the human experiments were done on patients, people who are in concentration camps. That came to light after the World War in what is known as Nuremberg trial, when the war criminals were tried. Horrendous experiences of human suffering through what they called as medical research came to light. At that time, a code of conduct was given for conducting studies on human beings, which is known as Nuremberg Code. That was the beginning of implementing ethical research in medicine. Even then, as years passed, there are several examples of unethical research which was prevalent worldwide at that time. One which is worth mentioning here is what is known as Tuskegee syphilis experiment, which was done in the United States, sponsored by the Department of Public Health, Government of USA in the year 1930 to 1970, 1932 to 1972, a 40-year study. They studied the natural course of syphilis in patients who are untreated with syphilis. At that time, there was no effective treatment. When the study was started, there was no effective treatment for syphilis. So they studied about 400 people they enrolled with syphilis, and they studied their natural course. What happened was by 1940-50, penicillin was invented, and we all know that penicillin was a dramatic cure for syphilis. In spite of a treatment being available in 1940, till 1970, they didn't administer them penicillin. They denied them the treatment of penicillin because they were poor community, they were from poor community, they were blacks, they were marginalized. So the experiment continued till 1970 when some journalist brought it to light. Almost 30 years after penicillin, people were being treated without treatment to know the natural course of syphilis. Many people died of tertiary syphilis. Many children died born with congenital syphilis and died. Spouses contracted infection. So 1970, President Nixon ordered the study to be stopped. So this is an example to show that when we do research, there are so many issues which are involved, which so many ethical issues are involved, and public health is involved. There is another interesting case report which is called as Wilbro's hepatitis study. We all know that initially the hepatitis was of 2 types. Now there are 5. Initially there are 2 types, infective hepatitis and serum hepatitis. The first study which found that there are 2 types of hepatitis was an experiment called Willowbrook hepatitis. That was done on a group of children with mental disabilities in a school which was meant for a specialized school for mentally disabled children. They convinced that children were mentally disabled. They took the consent from the parents saying that we are conducting a study to see the effect of a vaccine for hepatitis. At that time, hepatitis was relevant in the community. They said we are conducting a study to give vaccine for hepatitis children. And the incentive given was to if you enroll in the study, you will be given admission to that special school for mentally challenged children. So it came to light several years later that instead of the vaccine, what they were giving was hepatitis virus. So they were giving hepatitis virus and seeing the natural course of hepatitis in those patients. So there is another interest, I will not touch upon every case in detail. You all know HeLa cell lines. HeLa stands for Henrietta Lacks, a black woman with cervical cancer whose cells are immortalized. That showed that the cancer cells are immortal, and the immortal cell lines are created for doing research on laboratories on viruses and developing vaccines. So even today, many other research on viruses are done on human cell lines. For that, they use HeLa cell lines. HeLa is Henrietta Lacks, a black woman who died of cervical cancer. Her tissue was taken without her consent at Johns Hopkins, and they developed the HeLa cell lines. It raised several moral and ethical questions that became a topic for debate for several years, and even the legal dispute. Only in 2023, nearly 70 years after the initial case, the case was settled out of court in 2023. So I'm giving all these details just to highlight the fact that medical research is not something you do. You take a topic, you do a study, you take the data, and you publish. There are several issues which are involved, mainly revolves around the ethical concern. So to give a proper perspective, to give a proper guidelines for all these things, the World Medical Association in 1962 gave a declaration which is known as Helsinki Declaration of 1962, which are amended multiple times. And the latest declaration is in 2024, which defines how a research should be conducted on human subjects. And there are several guidelines which came later. The ICMGA guidelines is International Committee of Medical Journal Editors. COPE guidelines is a committee on publication ethics. Now I fast forward to 2025. This is a report which was published in Times of India, Mumbai edition, where a study which is currently being done by the government of India about the efficacy of BCG vaccine in the adult population to study the decreasing the complications of tuberculosis. I am not blaming any objectives or the aims of the study or the investigator. This is what happens when even the last person who is involved in the research is properly educated about conducting the research. The point raised in the article was the people were given BCG vaccination, but they were never told that they are part of a clinical study. They were told that you are giving a vaccine against tuberculosis. So nearly in Bombay alone, 16,000 vaccinations were given without consent. Consent was taken, but there are arguments on both sides, so I will not be judgmental. This is a report which published. So the idea is to show that even today, these issues are relevant. What happened 50 years ago, even today it is relevant. So everybody in the chain, from the principal investigator to the last person who collect in the data in the field, to be highlighted about the ethical aspects of the study and to explain to the study subjects what it means to be a study participant. And there are several ethical guidelines from, as I said earlier, ICMJA guidelines, COPE guidelines, World Association of Medical Editors, ICMR guidelines. ICMR has given a exhaustive document to how to conduct research on human subjects. And there are local guidelines, institutional review boards, ethical committees, Drug Controller Authority of India, CDSCO, clinical trial registry. If you are conducting a clinical trial, it has to be registered with clinical trial. And this is a document, ICMR document. It's worth reading to go through at least the part which are relevant to you, so that while conducting your research, you get some idea about what ethics is and how to conduct a good research. I will not go into the details of any of these guidelines. The basic tenets of all these guidelines involves around 4 factors. 1, you take an informed consent from the participant. You provide safety to the participant. Keep the safety of your study participant the foremost. 3rd, properly collect and properly analyze the data so that the results are reproducible and results are trustable. 4th, you maintain integrity, honesty, and transparency throughout the process of your research. It is very easy to explain what is not a good conduct. It is easy to explain what is a misconduct, because there are some criteria. If you don't follow these things, any of these guidelines, you fall into the category of research misconduct or publication misconduct. So research misconduct also means publication misconduct. If you do some misconduct at the time of publication, that is also a research misconduct. You do something which is unethical, which is not accepted during the part of your presentation and during your thesis, it's also a misconduct. Research needs to be done, as I said earlier, with integrity, and you should be accountable. A misconduct is intentional falsification of scientific data by presentation of fraudulent or incomplete or uncorroborated findings as scientific fact. There are several types of misconduct. Some I highlight, some I make a passing remark. Fabrication of the data. You fabricate data. Suppose there is no data existing, you create some data. You have not done say CRP, or you have not done, you are studying a patient with diabetes, you don't do HbA1c at all. You create all 50 patients, you give some HbA1c report, fabrication of the data. You don't do echocardiogram on the study population, you give that echocardiogram in all patients or this much, some patients. So creating data where the data doesn't exist is fabrication. Falsification of data is changing the data what you already have to suit your thesis or to suit your argument or your paper. You know that the treatment which you did, the study which you did was unsuccessful. That didn't show any benefit. But you want to show that the treatment was beneficial. So you change the data so that it assumes statistical significance. So that becomes falsification of the data. So doing something which is not there, writing something or mentioning something which is not correct becomes falsification. Then comes plagiarism, text images, copying other. Plagiarism may be text, plagiarism may be copying the images, lack of consent, duplicate publication, salami slicing, some I will explain later, ghost authorship, gifted authorship, selling authorship, manuscript manipulation of the peer review process, excessive self-citations, conflict of interest relation issues. All these constitutes authorship research misconduct. I will deal with only few things. The responsible behavior as an author, responsible conduct and some of the important misconduct which you should avoid, which you do not consider during the part of your dissertation or publication, and you land in trouble. So who is an author? Why authorship matters? Why do we need to be an author? Authorship gets you recognition. Authorship gets you citation. Authorship gets you promotion or grants or awards, etc. ICMGA defines 4 criteria to be an author. First criteria is he or she should have contributed substantially to the conception, design, data procuring, data analysis, and interpretation of the study. The second requirement is they should be involved in writing, reviewing, and editing for the intellectual content of the paper. All the authors who are considered as authors should have reviewed and accepted the final version of the manuscript which is submitted for the journal or to be published. And last but not the least, they should be accountable for the research they are conducting with integrity, authenticity, and they should be ready to involve in discussion post-research, post-publication. So if you meet all the 4 criteria, one will become an author. What are the issues which comes up during authorship? The one which is most prevalent is ghost authorship. A ghost author is one who he fulfills all the criteria. He writes an article for you, except that his name doesn't come in the author byline of the article. He takes a fee and he prepares an article for you so that you can publish in your name. It's an unethical conduct. Most of the times it is they are related to some pharma industry, like they are employees of the pharma industry, they have some conflict of interest, so they want the product or some molecule to be highlighted. So generally issues involve about ghost authorship involve around those issues. There is gifted authorship. Gifted authorship is somewhat common, like you gift your authorship to your friend, your colleague, your unit mate, or your even professor, though they may not be actually involved in whole part of the study. Then the most important research misconduct or scientific fraud is selling authorship. After the MCI or the initially MCI formed made it tagged promotions and qualification of teachers to publication, the selling authorship also became a problem. So you sell the author, you pay this much, you will be included as the author. Remember, when you submit an article, once the article is, you make sure about the author. Once the article is accepted, you cannot change the name of the author or the sequence of author unless without proper justification. You can't remove someone or you cannot add someone. That raises the suspicion among editors. There are some cases where some people would have contributed to the study, some people would have contributed to the paper, but they do not fulfill all the criteria. You acknowledge them. Maybe the staff of the hospital or the nursing staff or some senior professor who is not in your unit, who may not be directly connected, but who has helped you in the process. So you can acknowledge them in the author work. So important thing to remember, decide who is an author and what is the sequence of authorship at the beginning of the study. The sequence of authorship may not matter much always, but most of the international journals give importance for two authors, so first author and the last author. The first author is the one who conducts the most part of the research. Usually the postgraduate student whose thesis which is converted into a paper. The last author is the senior most person in the chain, is a professor or the head of the department who is involved, who is a mentor for the first author. So he becomes the last author. In between, the authors are graded depending in the decreasing order of their contribution to the manuscript. But in India, we have the criteria, NMC criteria says the only first three authors are considered as participated in the publication. So you make sure that your professor, you and your professor or guide becomes part of the first three authors. So corresponding author is one who corresponds with a journal office or with a reviewer. Generally, the person who has done maximum amount of work is a corresponding author. If a PG whose paper is presented, he is the corresponding author. Sometimes they avoid, if it is a first paper, they avoid because they cannot deal with editors or they cannot deal with the peer reviewers. They make a senior member in the team as the corresponding author. And do not include someone who cannot qualify, do not qualify for authorship. And do not exclude someone who qualifies to be an author. This is the reason very many authorship disputes come to editorial office. Resolve disputes at the level of your department, at the level of your institution. See that it doesn't reach the editorial office of the journal. Many a times, anonymous letters are sent to the journal editor saying that I was the PG in that unit and this is my work and this was being submitted as a paper. Generally, when you do a thesis, institution should have a reasonable framework, say 1 year or at the most 2 years. You convert your paper into, your research project into a paper. If you don't do it, somebody else in the paper in the department can take up that and publish. Maybe they can include you as an author. The institution should have policies like that. Otherwise, it's a waste of resources. You conduct study on so many patients, you have data and you don't publish it. If something is not published, it is not done. That is the saying. So you have to do it. If you cannot do it, allow someone else to do it. But people write an anonymous letter. This was my thesis and he has presented. So these disputes should be settled among the authors itself. And the next important, the most common form of misconduct is plagiarism. The word plagiar comes from the word kidnap, which means plagiare, which means kidnap in Latin. It's a Latin word. You kidnap someone's article, you kidnap someone's idea, you kidnap someone's emotion, you kidnap someone's text, image. That is plagiarism. You copy something you want as in the nth minute, in the next month you are to submit the article, copy some articles and paste. We have seen articles which 100% plagiarized. including they are so much reluctant to change that even the name of the institution was also different. So that type of plagiarism is never accepted. It's a scientific misconduct. The previous work may be yours or it may be someone else. Both amounts to plagiarism. Sometimes it is unintentional also. Even if we write an article, anyone writes an article, there will be some amount of similarity to any other previously article. None of us are, we don't think or write from zero or something from eternity. We take from other published article and write. So there will be some amount of similarity. So that is unintentional and that can be corrected. But intentional plagiarism is a scientific misconduct when it involves high amount of similarity with the published article. And this is most common and it is most easily detectable. The people think that it cannot be detected, but there are plenty of softwares and very easily, the first thing the editor does before sending it to a peer review process is to check the plagiarism. And at that time itself, the article may be sent back or we may ask to revise if it is minor plagiarism. Quotes, you might quote something in the article. That doesn't amount to plagiarism if you properly cite the reference from where the quote, like as quoted by so and so in inverted commas. At the end of the sentence, you give the reference. That is not plagiarism. You paraphrase someone's text, but at the end of the sentence, you give the proper citation and proper reference. That doesn't become plagiarism. Sometimes in the method section, they are very common, like everybody writes the same thing that the patient, so in data, BMI, height, or calculated. So they are common words, so it might match some text from other things. So there is little lenient. But if you employ a particular method, as employed by, if you say that we followed the method prescribed by or followed by so and so, you give proper reference so that it doesn't become plagiarism. You don't copy their methods. Statistics, everybody writes the same thing. Continuous variables are presented like this. Categorical variables were presented. Comparison was done by student t-test, chi-square test. So there is similarity between other articles. So that is exempted. Text recycling, the same author writes to multiple journals. Whether the same thing if he writes, whether it amounts to plagiarism, to an extent it is permitted, especially in the introduction section. Introduction, you take any article on diabetes, that starts with there are 250 million people diabetes all over the world, and by 2030 it becomes 300 million. So that is a very common way we start an article, so that is accepted. Self-plagiarism, like I publish my article in some journal, some make a change and publish in another journal. Most of the text matches. Self-plagiarism, that is also unethical. We detect plagiarism. There are various tools, online tools available. Most of the journals use Authenticate. Most of the institutions and universities have Authenticate, but it's a costly software. We use it only for our journal-related work. For personal works, there is another software, Plagiarism Checker X, which costs around $20 or so, which can be downloaded and which can take, before submitting it's good practice to check your plagiarism in the institution or with your friends or somewhere, that you can to check for plagiarism and correct it at that stage itself. And remember that not always, if the what extent it can be permitted. Up to 10 to 15% of similarity is given a go. 40%, 50%, 30%. Generally, we may ask to revise or we may reject outright. Duplicate publications already been covered to some extent. People send, they are in a hurry. They send to 3-4 journals simultaneously, and it gets accepted in 1 or 2 journals. A publication of an article which is already published somewhere is a duplicate publication. Submitting manuscript to multiple journals simultaneously. Sometimes they publish in a journal. They come to know later that it is not recognized by NMC. It is not an index journal in any of the indexing agencies. Then they submit to another journal which is indexed. So it's a duplicate publication. It wastes the resources. It wastes the resources of the editorial team, wastes the resources of reviewer, it duplicates the data and misinterprets the data in meta-analysis. And there are copyright infringement issues also. I take this article from this journal and publish in this journal, different publishers, they might sue for copyright infringement. And it results in retraction from both the journals. You think that you have 2 publications, but you might end up with no articles, though both the journals might retract your article. So you should be very careful in sending an article which is already published or which is likely to be published elsewhere. Send it to one journal, wait, and only after the decision of that journal, submit to the next journal. If you have published a work in a conference as an abstract or a conference paper, it is not considered as duplicate publication. If you publish it as a case report, or if you publish this as a letter to editor, and then you publish it as an original article, it is not considered as duplicate publication. There is another interesting type of misconduct, which is known as salami slicing. Salami slicing, you see that you have a study, we have done an original study with 1,000 patients, you have good amount of data. You don't publish everything together in one paper. You have data of 1,000 patients with hypertension or diabetes. You publish the BMI profile of the anthropometric profile of diabetic patients in Shimoga, one paper. Biochemical parameters of diabetic patients in Shimoga, another paper. Control of diabetes in this population, another paper. So you make multiple small papers. So none of the papers gives a complete picture. So this is a type of misconduct called a salami slicing. You make it 100 pieces and make 100 papers. That is not accepted. Pool them and give one good paper in a one good journal. Image manipulation, copying from another journal, most common with the case reports. You have a case report to publish, but you feel you have forgotten to take the photograph, a good quality photograph. You download from the internet or download from some other case paper or textbook and submit it. Image copying, it is unethical. Manipulating using Photoshop, and that is unethical. You generate an image using AI and submit it as a clinical photograph, again unethical. If you don't disclose, some journals do not publish. What is this? A case of fracture, both bones of lower limb. Yes? Are you still awake, or please get up? What's the picture shows? The X-ray shows fracture both bones of lower limb, fibula and tibia. And this is another X-ray of the same patient, reasonably healed X-ray, reasonably healed fracture. The only problem is the healing did not happen in the hospital, the healing happened in Adobe Photoshop. You know, this is an example of image manipulation. So all these things amount to publication misconduct. There are some issues related to conflict of interest. It may, as I said earlier, at this point in your career, like doing a dissertation, that might not be very relevant, but later course, when you take up higher, bigger studies, clinical trials, or when you get funding from some sources, these things matter. You have to disclose all conflict of interest. Your primary interest is the patient, the study participant, and the overall health of the community which you like to improve upon, or the overall improvement in the knowledge in the subject. Your secondary interest or your association with the company, association with industry, your personal gains. So there should not be conflict between these two. So all conflict of interest has to be clearly defined. And non-disclosure of COI is a research misconduct. Sometimes it happens that you received a grant from a company, you do a trial on that company, or you write a review article on that company's product saying that this improves the treatment outcomes in this patient, it's a wonderful drug like that. You don't disclose your association with the company, it becomes a misconduct. All the journals which have a form called ICMJE disclosure forms, where the authors have to fill up those disclosure form and submit it while sending it to journal. Predatory publications have already been covered earlier. Are never published in predatory publication. It may be very cheap. It may be 5,000 rupees, 2,000 rupees, but it's a waste of time and money. Nobody recognizes such publication. You just spend money and get a certificate or get citation, but not citation, sorry, DOI. But later on, NMC says that this is not indexed, this is not an index journal, and they might reject it. It cannot be published in a genuine journal later because it becomes duplicate publication. It harms the reputation of the reviewer. So before submitting, think, check, and then submit. What happens if you do research misconduct? Unfortunately, in India, as of now, there are no legal framework to try these cases of research misconduct, and there is no legal harm. But it substantially harms the reputation of the researcher and the person who is involved in the research. Generally, a complaint may be received by a reader of the article, and the editor-in-chief investigates according to the COPE guidelines. He sends a letter to the institution or the head of the department of the person, and if this is not satisfactory, they might take, or if the decision proves that there is research misconduct, they might decide accordingly. They may, if the article is in the stage of decision, it may be rejected. Any other article which are also under consideration may be rejected, or if it is already published, the article can be retracted from the journal. And the person may be blacklisted. Whereas in Western community, there are USA and other places, there is a mechanism available. Suppose if you are caught in research misconduct, your position may be lost as in the faculty or in the research, maybe grant position, etc. So it becomes an issue to be later. Whenever a journal finds some misconduct, some error, the article may be retracted. The journal article cannot be just deleted. Once you publish, it cannot be deleted from the website. It remains like that forever. So if there is some serious misconduct with the researchers, or if there is some serious misconduct with the ethics, or if there is some serious errors in the data, the journal and the publisher might retract the data, retract the article. It comes with a banner saying that it is retracted, and it remains like that. If the retraction is for some reasons like error in calculation of the data or some wrong conclusion, common, it can be accepted. Sometimes you can even publish it after correcting that. New England Journal of Medicine retracted an article on Mediterranean diet and benefits in cardiovascular disease for some data miscalculation. The authors published again in the same journal 1 year later by correcting all the mistakes. So such things do happen. It per se retraction doesn't mean a bad thing. But if the retraction happens for misconduct, that remains a record. It remains a blot in your academic career throughout. Because whenever you search your name in ResearchGate, or that even the retracted article also comes with a note from the editor saying that the article has been retracted for duplicate publication or plagiarism or like that. So avoid it at all costs. Whose responsibility is it to maintain ethics in research? It's everyone's responsibility, but the primary responsibility lies with the author, because you are the one who have done the research and you are the one who are publishing. The institute also has the responsibility to maintain a conducive research environment so that the people do research ethically and scientifically. The journal editors have a responsibility to see that the article which is published is ethical and scientific. And the readers have a responsibility to point out deficiencies in the published article so that the journal editors can correct it and even the authors can correct it. So in summary, how do you do, what is a responsible conduct, what is the responsible conduct of authors? Do not copy work or idea of other people. Take approval from the ethics committee. Take informed consent from all the patients. Keep the interest of the patient above all. Your interest, keep the interest above the interest of the research, or sometimes we make research. For example, you are doing a thesis on you want an investigation to be done. The ethics demands that you spend from your pocket. If I send that same test to a laboratory or make the patient spend, it is unethical, because there it is not clinically indicated for the treatment of the patient, but only for my research it is indicated. So it is imperative that I should spend from the research grant or from my pocket, rather than making the patient spend for that. Do not, never fabricate or falsify data. It is easy to detect. Any criminal leaves a clue. So it is impossible to fabricate or falsify data without leaving a clue. A good reviewer detects image manipulation. Good reviewer detects data manipulation. So do a proper analysis and report even if the report is negative. If the study turns out to be negative, you didn't find any significant relation or the causation in the study, still you report it. Why all this misconduct happens? Because there is an old adage which is commonly prevalent, which says that publish or perish. Somebody brought in this idea that you publish, otherwise you will perish. That is the reason which pressurizes people to publish at any cost and even going for unethical means. In fact, you can publish and still perish if you do research misconduct. You can flourish even without publishing. So it's all up to you. You need not, just for the sake of that fear of getting perished, you need not publish. You publish and perish is worse than not publishing and perishing. What is important is you publish and cherish. Once you publish, that should remain in a high impact journal. Dr. Vikram has published an article in New England Journal of Medicine. I think to the best of my knowledge, it's the only article published in New England Journal of Medicine from this part of the world. So these are the things which you will remain for long. one article, it may be a case report, it may be a letter to editor in Lancet, that you will cherish it lifelong. So that is the purpose of publication. So publish and cherish. I end my talk with this famous quote from Einstein. He says, many people say that it is the intellect which makes a great scientist. They are wrong. It is a character, said Albert Einstein. Character, the other word in Greek is ethos, ethics. So it implies that if you maintain good ethics, you are a good scientist. There are some other talks on related to this content, which are available on YouTube. If you can just scan this, and you can, if you are interested, you can listen to this. I have spoken about ICMJA guidelines, COPE guidelines for publication. Thank you for patient listening. I think I've taken more than what is allotted to me, because anyway, I'm the last speaker. We can take all the questions together. I will request all the panelists and the faculty to come onto the stage so we can have a quick panel discussion.
We extend our sincere appreciation to Dr. Srikant sir for his deeply insightful and principled address on ethics and integrity in research publishing. The practical insights you shared will undoubtedly serve as a guiding framework for all aspiring researchers. We are truly grateful for the wisdom you have brought to this topic. Thank you, sir. I now invite Dr. Sridhar sir to come forward and present a token of gratitude to Dr. Srikant sir. As we transition into the concluding segment of today's workshop, I now have the privilege of inviting all our distinguished speakers onto the stage for panel discussion and open house question and answer session. We now encourage the audience to actively participate and make most of the opportunity to engage our experts.
It's off. Mic, Raju. Mic to. Any questions, please raise your hand. Question. Okay. Okay, kudu.
Hello. Okay, please come out with your question, raise your hand, introduce yourself and ask question. Let it be very formal, informal. Don't hesitate to ask questions. Meanwhile, I start the discussion. I asked Dr. Balu, are there any options for grants for PGs to conduct research?
Okay, how many of you sitting here are in second year? Second year PGs? Okay. You can submit for a grant called now. It's from DHR. They give up to 1 to 1.5 lakh. Last year, one of our respiratory medicine PG in Subaya got it. So please check that grant from DHR. Maybe we'll put it in the group that is currently available. So you need to keep track every period, April to May is when the DHR grants called. Again, there are selected areas. Let me also clarify that not all theses, all areas gets funded, as Dr. Vikram was mentioning. Just look at the areas. I think most will fit somewhere, other than surgical side. But there are surgical side grants also. I just checked when Dr. Vikram was talking. If you Google, just type surgical thesis grant, there are 3 organizations which are actually giving grants for theses. One is that, sir, currently what is currently available from DHR. Anybody from medicine sitting here? Medicine? No. It's fine. Anybody working on diabetes, sir will be knowing. There is something called Research Society for Diabetes in India, RSSDI. Again, they give grants for PGs, also faculty. See, the way I look at it is faculty should broaden your thesis and apply for a faculty grant, which are much bigger, right? Faculty grants are many. So it's your guide or whoever is willing, they should scale up your thesis topic into a much broader area, take much bigger grant. Some part of it can be utilized for thesis. But in specific to PGs, one is DHR, RSSDI is there. Somebody working on, yes sir.
Association of Physicians of India Karnataka chapter had a PG grant for medicine PGs for research. Unfortunately, the uptake was so low that we had to cancel it. Probably the PGs nowadays are more not interested. The grant was available from our association, but there are no takers, so we had to, no, medicine PG, yes, only medicine PGs, the APA members.
There is a grant, somebody, this is not for thesis, okay, whatever RSSDI is not exclusively for thesis, you can submit separate research grant. Somebody wants to work on adolescent, there is a grant up to 2 lakh. This is purely for PGs. What I am saying now is non-thesis part. Only the DHR is related to your thesis. This is from Mamta Foundation, Delhi. They mainly support any postgraduates who work in the area of adolescent. They call it as fellowship grants. It's for an year. You have to do some study and they'll have a contact program. In addition, people working in TB Association of India gives grants. We also give grant from task force, roughly amounting to 1 lakh, both these grants put together if you're working in TB. These are some key grants available. There are many. What I will do is, I'll put all the things in the group, keeping in mind shortage of time. Yeah, first year PGs, if you are not taken topic, it's good to explore. Don't take topic because you will get grant. No, that is very tough because the DHR grant are given to only 100 PGs in India. That's how competitive it is. Take the topic, as Madam mentioned in her slide, if you have passion for doing research, if you're lucky, if your study is good, you get funded. I'll put all the things in the group, sir. Yeah.
Any questions? Yes, madam, question to you, madam. How interdisciplinary research can be done? Like you are you are in the multidisciplinary research unit. Most of the times, the PGs when they take thesis, they take on their own department. There is no multidisciplinary involvement. How do you promote a culture where interdepartmental dissertation can be done so that a group of patients, say a surgical case, the surgery PGs can do it, pathology PGs can do it, radiology PGs can do it. So how can we coordinate among the PGs so that the same set of patients, now the number of PGs have increased, so but the number of patients or the specific disease they may not get sufficient number of cases. So what they do is they do thesis on 50 patients in 3 months, which never gets accepted in any journal. Only if they can have a good number of patients and multidisciplinary involvement, that has a high chance of acceptance in journals.
So before going to that, so our is multidisciplinary research unit. So all the PGs who are from outside or from actually our institute, so they can utilize the MRU for your first actually choosing a topic, it's feasible or like that, or anything actually which is needed for your research, writing a paper or design and new novel thing actually if you want, and you want to do some biomarkers also, but you don't have where actually you want to store the sample, like that it is, you have a problems, then we facilitate everything which is actually under limit in a MRU, we will do actually. So for all actually the PGs, even undergraduates for STS project and everything, and now actually we are helping for faculty, so we have started, and maybe in next few years we are going to fund for the PGs 1 or 2 PGs with a novel work, and also for the STS project that is actually given by DHR, so through MRU. So they are actually initiated. Maybe when the fund is going to be released, then I'm going to be through our nodal officer, we will going to intimate to the group. And how actually now the question raised by sir, so how actually we can do multidisciplinary? So gynecological PGs can club with the pathology, right? And oncology department, they can club with again pathology people. And general medicine PGs, they can club with the biochemistry because they have some instrument also which is not present in your department. Okay, cardiology with the general medicine. So diabetes is there, hypertension is there, some tests they are going to do there, some data is going to be there, and newly diagnosed actually hypertension leads to cardiovascular disease that you can get from the OPD of the general medicine only. So make actually like interdisciplinary and you can do well, and it is going to be highly valued and it has a novelty also. So like that you can do so. Next actually question, if it is there, the right person is our nodal officer, and hand over to him actually.
MRU was started in Karnataka for only 8 medical colleges. It was a central government initiative to promote research in medical colleges. It's not that it should be restricted to SIMS. They always encourage, DHR always encourages to do multicentric trials. So we are just talking in the interval with Dr. Vikram sir. So we have the enough patient material. They have the faculty. So why don't we collaborate and do a multicentric trials and all? We are already made the proposals, so we'll do it. Even for the PG point of view, you all can approach our MRU. It's not that only SIMS PGs should come. All DNB institutions, SWIMS is not swimming, Subaya. Everybody can approach us. We will prepare a proper platform for you. We'll guide you. Even the statistics part also will be taken care of. Think that Shimoga is a unit. Don't think Subaya is different, SIMS is different, nothing like that. Okay? So we extend our cooperation to you free of cost. Okay.
It's a great initiative.
Can people who are not in medical colleges collaborate with you in MRU?
Yes.
Is there any restriction or any?
Only thing is with your institution we need to have a MOU. That's the reason, only thing. And for the UG students who are keen in doing research STS projects, we had a recently conclave in Delhi where all the medical colleges, about 118 medical colleges, all MRUs participated. And the Secretary DHR also promised us that not only for PGs, even the UG STS project, if they don't get grants outside, DHR will sponsor them. Every year DHR gives 20 lakh rupees as for the continuation of projects. But money is not at all an issue if people are coming forward.
Does it require any investigator from your institution?
Yeah, the only thing is when an MO is done, the MRU people or some institution people will be one of the investigators. The principal investigator can be the person who is actually doing the research. So co-investigator will be one of the faculty or the research scientist from MRU.
We will share what are the instrument is available in our department. So then you can design your projects actually. We will help PGs also now in the SIMS. Mainly actually OBG peoples, medicine people, they are actually interested, but other we are not getting. So if you are interested in any way, even ISC also we are going to start for the pathology also. Then we have inverted fluorescent microscope also. So you can utilize all those things for your work and enhance the research.
University PhD students are also utilizing our instruments. Okay, so some sort of MO is being created.
Question for Dr. Anupama. Like many people, when they submit article to us, especially the review article, they take content from other book, like a picture or a diagram or a flow chart, what are the copyright issues involved in such submissions? And how to get such content without violating copyright of some other journal?
When you are trying to copy some image or something from another article, another journal to this journal, there is always something called copyright. While copyright you have to apply to that person or the publisher who has brought out that particular journal. You can apply to that particular publisher or the author. Usually the rights lie with the publisher, and you have to get the written permission, or by mail if they have to send the permission. Then only if you have to reproduce with permission. You might have seen that reproduce with permission. That will be there in the below the figure or any other chart. For especially for algorithms, this is very important. And sometimes it can be an open access journal. It is published earlier in an open access journal, and where in that usually you just go through the copyright agreement, and some below the article, in the first page of the article, there will be a mention of which copyright agreement this article belongs to. For example, Creative Commons something. So CC, BY, NC, ND, there are all specific indications as to how you can take out the material. So there are some specific license agreements. So if it is CC, BY, NC, for non-commercial use, you can always copy, bring out that particular image and use it in your journal. It is not 100% necessary to get a written permission in that case. But still, it is always better to approach the publisher and get the written permission, just to be on the safer side. You cannot directly reproduce it. But if in case you don't have time, or you have some difficulty in getting the written permission, what you can do is you have to modify that particular chart or algorithm in your own way. If you have substantially modified that particular algorithm in your own way, then it is not necessary to get the written permission. So that is also there.
Dr. Vikram touched upon the use of AI in publication. There are some areas which are contentious and some areas which are permitted. And there are some AI tools which you mentioned which can be safely used to enhance the quality of paper. Can you highlight to what extent it is permitted? What are the safe areas which we can use?
Right, sir. Before I go to that, madam asked, no, how can you participate in MRU? The only thing is that you will have to get a GCP certificate. GCP is Good Clinical Practice Certificate. You can associate with us, with them. And for all of you here, you have all passed your GCP and BCBR. So the ones who have not done, you will have to do it. So whatever you've witnessed here is what you will have to do again. BCBR is the basic course in biomedical research, which is compulsory for them. So all the modules that we taught here, the same thing they will have to go through. And unless they get the BCBR certificate, they are not eligible. So GCP no kuda, it is compulsory. GCP no kuda, whatever we have taught here or whatever we discussed here in the workshop is the thing that you will all have to do. So it is just like a primer for you. It will be easier for you to follow those videos. They have videos. NPTEL conducts it. Yeah, NPTEL they have the self-directed, self-paced learning courses. So it's compulsory for them. So it will be very useful for you. It is important that you will have to go through this, because it is BCBR certificate is a must. GCP certificate is must. Now coming to AI, last 1 year in that the number of output, the Chinese output have increased by 100 times. If you look at Nature, look at Springer, look at Walter Kluwer's and also Frontiers and Frontier publications. These are publication houses. Last 1 year in that the number of publications that China alone has done has multiplied by almost 10 to 20 times. When they did the review, they found out that they were doing it through AI tools. ಅಷ್ಟೇ ಅಲ್ಲ, AI ಟೂಲ್ಸ್ನಲ್ಲಿ ನಾಟ್ ಓನ್ಲಿ ಕ್ಯಾನ್ ಯು ಜನರೇಟ್ ಅ ಸಿಸ್ಟಮ್ಯಾಟಿಕ್ ರಿವ್ಯೂ ಆರ್ ಅನ್ ಒರಿಜಿನಲ್ ಆರ್ಟಿಕಲ್ ಇನ್ ಅ ಮ್ಯಾಟರ್ ಆಫ್ 10 minutes. You can also get rid of all the AI signatures in a matter of few seconds. Aita, so you can generate whatever you want, data, figures, tables, the entire systematic review, you name it and you can generate it in a matter of few hours. The same time you can also get rid of all the AI signatures in a matter of few seconds. Why I am telling you at the beginning is, itara aagta ide, but let us not do that. Let us not fall for these kind of malpractice or misconducts. Let us use AI tools for all good reasons to conduct a research appropriately. Having said this, ivaga ಕೆಲವು ಜರ್ನಲ್ಸು ಹೈ ಇಂಪ್ಯಾಕ್ಟ್ Q1, ಈಗ ಇಂಪ್ಯಾಕ್ಟ್ ಫ್ಯಾಕ್ಟರ್ ಅಂತಂದರೆ ವಿ ಬ್ರಾಡ್ಲಿ ಡಿವೈಡ್ ದಮ್ ಇಂಟು Q1, Q2, Q3, Q4 ಅಂತ. ಕ್ವಾರ್ಟೈಲ್ 1, ಕ್ವಾರ್ಟೈಲ್ 2, ಕ್ವಾರ್ಟೈಲ್ 3. ಸೊ ಹೈ ಇಂಪ್ಯಾಕ್ಟ್ ಫ್ಯಾಕ್ಟರ್ ಅಂದರೆ ಕ್ವಾರ್ಟೈಲ್ 1 ಆ್ಯಂಡ್ ಕ್ವಾರ್ಟೈಲ್ 2 ಜರ್ನಲ್ಸ್. ಈಗ ಹೈ ಇಂಪ್ಯಾಕ್ಟ್ ಫ್ಯಾಕ್ಟರ್ ಜರ್ನಲ್ಸ್ನಲ್ಲೂ ಕೂಡ ಇಫ್ ಯು ಡಿಸ್ಕ್ಲೋಸ್ ದಟ್ ಯು ಹ್ಯಾವ್ ಯೂಸ್ಡ್ AI and if you cite AI usage as one of the authors, they have started agreeing. Few journals.
You can use in the methodology section, you have to describe how you have used AI, which AI tool you have used, and to what extent. Or you can acknowledge, at the acknowledgement section, you can mention that we have the most easily accepted is language editing tools. Like you use ChatGPT for language editing, or you use Grammarly. Grammarly you need not even mention. Most of them use Grammarly for language correction. So other tools, but you should not use AI to calculate the data or to interpret the data. You can use formulas given by AI. You have to check it and use it. But don't make the results or comparison based on AI, because AI can have what is known as hallucination, so the output cannot be always correct. So you should be careful in those things. Images, some journals accept, some journals do not accept. Some journals accept with a rider that you have to disclose, this is an AI generated images. Many journals do not accept even the images. So these things, I think we have been talking all day along. We need to hear from you. Otherwise, it has become a complete monologue. Maybe some questions from the audience would make it interactive. Yes.
As a pathologist who practices in a standalone laboratory, I do come across interesting cases. It so happened I had a fetal autopsy. It was a very unusual case. So I had to take a second opinion from a senior. So now for me to present that as a case report, what should be my, where should I mention that I have taken second opinion? As a second fit, soon after I sent the slides to my senior, I immediately after reporting, I again got the call whether they could use it to present the case. What should I expect?
This is an interesting case scenario. Like it happens to many people. Like when you see the patient first and then they get referred elsewhere. If you have seen the patient, you have made a diagnosis. It is your case to be presented. You should be the author. You asked an opinion, a help, an opinion. You can acknowledge them in acknowledgement section of the case report. You can mention that their input was taken. But basically, you have done the autopsy, you have done the initial work. It is your case report. In the case report, you can thank them. That's all. In the acknowledgement section, and never give that case to others just because they have given an opinion.
If you ask me, I would be very happy. If someone is coming and asking you, can they use your image? You should put your foot down and say, please use it, cite me as the first author. That will be easy, because you will have a publication in your name. They will do all the running, they will do all the money spending, they will publish it, but your name will be in the first author. So actually that will be a win-win situation if you ask me.
That is possible, but there many a times they might even avoid mentioning your name. That you need to be very careful. That should be mentioned beforehand. Like, yes, yes.
For topics, the national permission or the ethical committee clearance is accepted. HIV related topics. HIV related, like in pregnancy, if I want to publish any retrospective
Yes,
study on HIV.
anything in HIV, particularly if, let me put it this way, if you're collecting all the data from ART center, you have to take permission from NACO. If you are not touching any of the NACO facilities, if you are doing on your own, no issue. That's how the NACO has made the guidelines. If any data which is taken as a from the program part, then we have to write to state AIDS Control Society.
Even to the national.
They will forward it to the national and get the approval. Approval you will get, but it's a lengthy process.
Yes, yeah, that's right.
On behalf of the organizing committee and all participants, I extend our heartfelt thanks to all our esteemed speakers for the valuable contribution to the panel discussion. Your collective insights, thoughtful responses, and open exchange of ideas have greatly enriched our understanding of the research and publication process. We are sincerely grateful for your time, guidance, commitment, and the valuable knowledge you have shared with us today. Thank you. As we come to the close of today's insightful and thought-provoking session, I would like to express my deepest gratitude to all our distinguished speakers for their invaluable contributions. I also wish to thank the audience for your active participation, thoughtful question, enthusiasm throughout the day. We extend our heartfelt gratitude to Dr. Sridhar Sir, IMA President, and Dr. Vinaya Ma'am, IMA Secretary, IMA Shimoga, in organizing this workshop. We trust that knowledge shared today will serve as a solid foundation for all our participants, empowering them to navigate their research and publication endeavors with confidence. On behalf of organizing committee, thank you once again to everyone, and we look forward to your continued participation in future events. Have a wonderful day ahead. I would like to invite IMA Secretary Dr. Vinaya Ma'am to kindly come forward to deliver the acknowledgement note for this session.
That was a very interesting and informative workshop for all the postgraduates. So in addition to the speakers who have delivered their wonderful lectures, we would like to acknowledge the other people, technical team and other people who also helped us in making this program a great success. I call upon our president to give a small token of gratitude to the technical team led by Mr. Chetan for helping us for the live streaming as well as uploading the recorded video to our YouTube channel. Mr. Chetan and Mr. Vinay, who are there from the beginning from 9:30, morning 8 o'clock only they have come here to set these technical things. Thank you. I also would like to acknowledge the help given by Dr. Rajalakshmi P., who is second year postgraduate in ENT department, final year postgraduate in the Department of ENT in SIMS. I would like to request our president to give a small token of gratitude to Dr. Rajalakshmi. We also have Mr. Shreyas, second year undergraduate student from Subha Institute of Medical Sciences, who is also here from almost 9 o'clock doing all the coordinating work. I request our president to give a small token of gratitude to Mr. Shreyas. We have here Ms. Shreya and Ms. Vinuta from Subha Institute of Medical Sciences. I thank them for coordinating the event, being volunteers here. I request our president to give a small token of appreciation.
Now, as we conclude this informative session, I would like to invite everyone to join us for lunch. Thank you. Have a great day.